morning, everyone. I hope you're all doing well. And of course, Mike, let me know if there's any problem with people hearing me. It is 9 o'clock and it's Monday, September 20th. So this is the first day of our Wisconsin Enrollment Conference. So I think we're going to go ahead and get started. So before we move into that first session, which starts at 9:15, we do have some welcome and introductions that I want to cover. One, just thank you all so much for being here, taking the time to attend, to be present. As we did last year, this is obviously a virtual conference. Sometimes can feel a little hard to be present, but we are just thrilled to have more attendees than ever. And I'll get into just some of those numbers in just a moment. But first, I think, we've been doing this since the very beginning. And I don't know that any marketplace year, no marketplace year has been the same. This year may be more unique even than others. I guess that's up to everybody to decide. And we don't typically have themes for a conference. We don't this year either. And I think in part because if we had a theme, it would always be the same. The theme being transitions. And it's partly because, as we know, the policies and rules and regulations of this work are constantly changing. And that is very true of this past year. It's going to be true of the year ahead. But it's partly also transitions between coverage. That's so much of what this work is just helping people to navigate from one place to the next. Medicaid, Badger Care, Marketplace, really often are these places that people move in and out of. And I think I never really fully understood how much transitions are challenging until I had a kid who started preschool. And I remember the very first few days when they started that the teacher at the end of the day would just say, well, they handled transitions okay. I had no idea what they were talking about. And it took me a while to realize the reason that they focused on that was because that was the place where a lot of things fell down, where a lot of things fell apart, the movement from one place to another. And so I think that's why this role is so important. And we talk to our staff quite a bit about that, it is in that movement from one coverage to another, from no coverage to coverage, from one coverage place to another when you age out and into other things. And that's what your role is, but I probably don't need to tell you that. With this year, there's just so many new and exciting things happening. You probably already heard, as was announced very late on Friday, as per common practice these days with CMS, that the open enrollment period will be extended this year by another 30 days. So it'll actually now end January 15th. So I'm sure in the coming days with the sessions that will be addressed as much as we can and wrapped into just whatever we can in the sessions. But also in the year to come, there will be potentially, we expect, the unwinding of the public health emergency, which you'll also hear about. Before we get into some logistics, I wanted to thank the folks who helped to make this possible. So we have many sponsors every year who make it possible to provide this conference at overall a very low cost for you or at no cost, because again, we want to make sure it's accessible and that people can be here to help others. So I wanted to thank the sponsors. First and foremost, Wisconsin Department of Health Services, as well as the Wisconsin Office of the Commissioner of Insurance. They've been present and helping to support this conference from the very beginning. And obviously, for those of you who are seeking pre-licensing and continuing education credits, Wisconsin Office of the Commissioner of Insurance makes that possible. I also want to thank Anthem Blue Cross Blue Shield of Wisconsin, Common Ground Healthcare Cooperative, Group Health Cooperative of South Central Wisconsin, Molina, Quartz UW Health Unity Point, Wisconsin Hospital Association, and Wisconsin SMP. And of course, there's a planning committee. It's not just me, and it's not just anybody else. It's the whole group of people outside of Covering Wisconsin. So I want to thank Julia Garvey, Marcia Gomez, Stan Hudson, Shelley Knorr, John Rathman, Rebecca Rebholz, and within our own Covering Wisconsin staff, Jen Ball, Courtney Harris, and Mike Moriarty specifically. But I do also want to thank the larger Covering Wisconsin staff, which has expanded this year. And I'll talk a little bit more about that in just a second. So we have, in addition to the three I've already mentioned, we have Shannon Drake Burr, Nick Duke, Kathy Duchesne, Colleen Harriman, Kirk Moore, Quintella Perry, Stephanie Sievers, Kim Turner, Adam Van Spankeren. And I also want to acknowledge we have a student. Since we are situated at the UW-Madison, we get the benefit of many students who help us throughout over the years. Currently, we have Anthony Ruiz, who is helping us with data. So I don't think I ever mentioned how many people are actually attending this year. So we have over 350 people who have registered, which I think is the largest ever. We also have at least 70 people signed up to do the pre-licensing, which also I believe might be the largest ever. Maybe close to when the very first year when the marketplace was new. So that's fantastic. And it shows that there is an expanding workforce in this state. And I want to acknowledge that Covering Wisconsin, as you may have already heard, we were able to successfully pull down the Federal Health Insurance Navigator Grant again this year, which is always thrilling to hear that we can bring that to Wisconsin. We've been doing that since the very beginning. There's been ups and downs, as you're probably aware, with that opportunity. And this year is the largest investment ever from the federal government into this capacity. So we're thrilled to both be able to continue that role and expand it. We'll be sharing more information in the coming days and weeks about who all those entail. But I did want to mention the entities in the state that we've been able to bring on as upcoming or current navigators who will continue. So in addition to Covering Wisconsin and our team, we have ABC for Rural Health, Centro Hispano of Dane County, Family Health Centers of Marshfield Clinic, Gerald L. Ignace Indian Health Center, Partnership Community Health Center, Northern Wisconsin Concentrated Employment Program, and Wisconsin Institute for Public Policy and Service. Really thrilled to bring more geographic diversity to this opportunity. We've always served everyone in the state, but we know that having people placed physically in various locations really helps. And of course, just an expanded capacity overall always helps. And of course, it's more than just the navigators. There are so many of you who are agents and brokers, certified application counselors who are doing this work. Those of you in IM agencies, financial counselors and clinics and hospitals, legal aid agencies. There's so many in this work who are helping consumers. All right, well, I want to just go over a few logistics before I hand it over. So if you've been attending some of the pre-licensing, those of you who started last week, thank you. You're in your second week. You already got a little bit of an introduction to or a review of what some of those criteria are. Continue to attend. The same thing for those of you getting continuing education. Just show up and attend and enjoy and follow along, and we'll pass along your information to OCI at the end of the conference to get you your credits and your certification. For those of you also who are especially doing the pre-licensing in preparation for the exam, we know that exam can be a challenge for anybody. And so we want to offer two sessions. The first one is actually open to anybody at the end of the conference on October 1st. There will be just a 1-hour office hours. If you have any questions that you felt didn't get answered, or you'd like to dive in with a couple of our seasoned navigators on something more complex, that's more of a freewheeling, open discussion session. Information about that is included in the emails that are sent out to you in the morning and also on our website. And then there's also a study session. This is really geared towards those who are doing pre-licensing. And that will be also on October 1st, that Friday, a little bit later that morning, 10:30 to noon. And like I said, it'll be really geared towards those who are preparing for the study session or the pre-licensing exam to really talk over, again, the very specifics of what will be covered in the exam and make sure you feel prepared as much as possible. We will be using the Q&A function for today. And so that's the preferred way to ask questions and get them answered. That way they can be documented and try to keep things clear. We know with chat, it can get a little muddled. And otherwise, all attendees are on mute with video off. And so again, if you have a question, asking in that Q&A. All right. So, and Mike, I'm going to introduce you quickly to Mike Moriarty, who is the tech guru who is helping us out today and really throughout the entire conference. Is there anything else, Mike, in terms of tech logistics that you'd like to make sure that people are aware of? Or I feel like there's been maybe a little bit already in the back and forth on the chat.
Yeah, absolutely. So like Allison said, if you have any questions, please just use the Q&A function. Our moderators and speakers will try and get to those as quickly as possible. Otherwise, if you are having any technical issues, you can't hear anything else, please contact me at memoriarty@wisc.edu. That is in the chat as well. But for those of you who might not have seen that, I am checking my email frequently, and we'll get to you as quickly as possible on that as well.
Great, thank you. And later today, every day we'll be doing a gift card drawing, a random gift card drawing. For those in attendance, you have to be present to win. So it's extra incentive. We'll do that at the end of every day. But today we have a special gift card drawing, names of those of you who submitted photos. Thank you so much. We'll actually be showing those photos starting tomorrow as part of the opening slide presentation. But so thrilled. We love to see your faces again. It's so hard when we're all virtual. But those names, the 3 individuals that will receive a gift card are Lynn Tank, Laura Martinez, and Piang Tao. So thank you very much. We appreciate seeing those photos. And now I'm going to go ahead and introduce the moderator for our opening plenary session. And then I will hand it over to her. So Stephanie Harrison is the moderator this morning. She is the CEO of the Wisconsin Primary Healthcare Association, which is the membership association of Wisconsin's federally qualified health centers, FQHCs, also known as community health centers. So Ms. Harrison served as chair of the National Primary Care Association Leadership Committee and currently serves on the boards of Wisconsin Health Plus, the Advancing a Healthier Wisconsin Endowment, and the Wisconsin Early Childhood Association. She was a founding member of Wisconsin Partners, a community building network focused on building enduring, broad-based relationships that make bold action possible. In addition, she was a fellow in the National Public Health Leadership Institute, Cycle 17. She has a bachelor's degree from St. Olaf College and Master of Arts degree from the Lutheran School of Theology of Chicago. So thank you so much, Stephanie, and I will hand it over to you.
Thanks, Allison, and good morning, everyone. Before I introduce our speakers this morning, I wanted to just take a minute to celebrate. First off, I want to celebrate all of you who are in attendance here today. You have done an amazing job keeping people covered and getting people covered in a year with momentous change. I don't know how to emphasize momentous enough. Also want to just celebrate Covering Wisconsin for securing the new Navigator grant. That's exciting and a terrific resource for us here in Wisconsin. And lastly, want to celebrate all of us because we are persevering in a global pandemic. I think everyone has to deal with their own life, whether it's childcare or just even getting groceries, getting to work. And you all are showing up in service of other people here in Wisconsin. So thank you. That is also very well worthy of celebration. So it's my pleasure to introduce our two speakers this morning. First, Jim Jones. Jim was appointed as Wisconsin's Medicaid Director in February of 2019. He has worked on health coverage and human service programs for over 40 years. As the Medicaid Director, Jim leads multiple programs for Wisconsin that serve nearly 1.5 million members with an annual budget of $12 billion. Prior to his appointment, Jim worked as a consultant assisting states, federal agencies, health plans, nonprofit organizations, and providers develop their strategic visions and help them develop the policies, processes, and systems needed to achieve their objectives. In the 31 years before consulting, Jim worked for the state of Wisconsin, including 4 years as Wisconsin's Deputy State Medicaid Director and SNAP Director. Our next speaker is going to be Nathan Hodek. Nathan was appointed Deputy Commissioner of Insurance for the state of Wisconsin in January of 2019. Deputy Commissioner Hodek serves as the Chief Operating Officer for the Office of Commissioner of Insurance. In that role, he is responsible for managing the office's regulatory, communications, legal, legislative relations, and administrative functions. Mr. Hodek brings over 15 years of experience working in and around Wisconsin state government. He has worked on health insurance policy and regulatory issues in a variety of roles in the public and private sectors. He has also served as Chief of Staff for the current minority leader in Wisconsin State Senate and is a principal at one of Wisconsin's largest public affairs consulting firms. Deputy Commissioner Hodek grew up in northern Wisconsin and earned his BA and MBA degrees from the University of Wisconsin-Madison. So please join me in welcoming these two speakers. We'll all virtually clap, I guess. And at this point, I think what we're going to do is turn it over to Jim to start. Before you start, Jim, I just wanted to let folks know there is a Q&A button at the bottom of your Zoom screen. And if and as you have questions that pop up, feel free to post those questions right in that Q&A box. We will be monitoring those questions and then posing them back to our speakers as soon as both have had the opportunity to present their prepared remarks. So with that, welcome, Jim, and I will turn it over to you.
Thank you, Stephanie, and thank you, everyone, for being here today and inviting me to share this opportunity with you. I want to thank you also all for the great work you did now and in the past to make sure that we keep Wisconsin members covered by health care and that everybody can have access to quality health care, which we have a great quality health care system in this state. So I'm going to talk a little bit about what we're doing in the Division of Medicaid Services and the Department of Health Services concerning the public health emergency and some other system improvements that we think you need to know about. So can we go to the first slide? It's really the agenda of what we're going to be doing. We're going to be focusing on unwinding the public health emergency a lot. There's some changes that you need to be aware of and timing things that we need to talk about. We're going to talk about partnerships and collaboration that are going to be necessary to do that and the timeline to do that. We're also going to talk about two things at the end. One is the access modernization tool that we're working on, and also the HMO enrollment tool that'll come and be in place at the end of October. So let's go on to unwinding the public health emergency on the next slide. And then we'll go 2 slides there, Michael, if you don't mind. Due to the COVID-19 pandemic, DMS implemented a number of changes in eligibility-related policies and processes in both Medicaid, Badger Care, Food Share, Senior Care, all of them, right? This was always intended to preserve healthcare coverage during the pandemic. It also meant that with the Family First Coronavirus Act, we were required to keep people on the program unless they asked to be off the program, unless they unfortunately passed away, or if they left the state, as a condition of receiving enhanced federal money. That federal money, it was equivalent to about $50 million a month. And we've been receiving it since April of 2020. And we will continue to receive it through the end of the public health emergency. So let's go on to the next slide and talk a little bit more about what the policy changes were. Again, we continued coverage for all the Badger Care Plus and Medicaid existing members. We postponed all renewals. There were no renewals in Medicaid and Badger Care. So use of best available information was used in verification. We couldn't really ask people to, hey, verify this with your employer when your employer was closed. We suspended all the premium programs, the treatment needs question for Badger Care childless adults, and we also suspended the Medicaid purchase plan work requirements. And finally, we expanded presumptive eligibility to the elderly, blind, and disabled population. That actually isn't allowed under federal or state law, but it's something that we felt we needed to do if we need to get coverage for those individuals, especially during the pandemic, when we saw so many people who were older and people who had a disability become ill, and we wanted to make sure that they were covered and that Medicaid or someone was picking up the bills for their care in case they needed to get some COVID care as we went along. Next slide. So when it comes to what are we going to do to unwind the public health emergency, we need to really minimize the impact of all this on our members. They've been getting care since, they've been having continuous healthcare coverage since really April of 2020. They haven't really had an opportunity to report a lot of changes unless they were also eligible for our food share program. And so we've just said, hey, everything's good. We want to make sure that as we work together now, as we collaborate with you and with the community and others, we want to make sure that, number one, we're informing and educating our members about the upcoming change. And one of those things I'd like to highlight is also the need for them to get their updated address or phone number or email to their worker so that we know where we're sending stuff and that they're getting the information that we're trying to send out to them. It's also going to be necessary for us all to work together to do outreach to members and assist with renewals, which we'll talk about in just a second. And finally, we have to assist those, and there will not be probably a small number, who are ineligible for Medicaid and Badger Care because of income or household changes. And we need to help them in their transition to the federally facilitated marketplace, the FFM, or other quality coverage, be it veterans or private health insurance through their employer or whatever. We just want to make sure that our biggest goal is to make sure that people remain covered by something. Next slide. So when we talk about our partners and our community collaboration, here are all the groups that we're already talking to and beginning to work together on the public health emergency unwinding, including our friends at Covering Wisconsin through the OCI DHS Health Coverage Partnership. We've been working with them on a biweekly basis to talk through all issues, but now that the unwinding is here, it's going to be especially important for Covering Wisconsin to be involved. Also, disability advocacy groups. Sometimes we think that the people who got covered, because that was where the large increase were Badger Care families and pregnant women, et cetera. The thing is, no one in the program has had a renewal since April of 2020. No one's reported really changes unless they've been on food share since April of 2020. So we need to make sure that we understand that this is about Badger Care. It's about Medicaid. It's going to be about senior care. It's also going to be about family care and IRIS as well. So we need to make sure that everybody knows across the whole program that this affects everyone. We also know that we're going to work with Stephanie and all the federally qualified health centers in this collaboration. We're going to need to work with our health management organizations, our managed care plans, of which we have many, both on the Badger Care, the SSI managed care, and on the family care side to make sure this happens, including the IRIS consulting agencies. We're going to work with the Wisconsin Hospital Association and our hospital partners. Of course, we need to work with our income maintenance agencies because they're the ones who are actually doing the work of completing these renewals. Again, the managed care organizations for family care, Milwaukee Enrollment Services as well, the tribes, food share outreach partners, the enrollment networks around the state, and any other community-based organizations that are out there that we work with on a regular basis or who are interested in working with us. So let's go to the next slide. We have tried, and throughout the entire public health emergency, to keep our members updated through Forward Health about what's going on and what changes were made during the COVID-19 public health emergency. Our key message, as it says, you're going to keep your benefits during the COVID-19 federal public health emergency. And so I think we did a good job of that. We didn't get a lot of questions that we heard about. It wasn't a landslide of things going on. Usually when people keep their benefits, everybody remains pretty darn happy. So next slide. So unwinding, let's talk about that for a minute. Back in August, CMS finally, and I want to include the word finally, released the state official letter, they're called show letters, which provided guidance to the states about what are we going to do when the public health emergency ends as it pertains to Medicaid and our CHIP program, Badger Care. And really updated some of the previous guidance, which was a little weird, from CMS issued back in December of 2020. CMS is working with the National Association of Medicaid Directors. I'm on the board there to further refine their guidance, and as stated, more detailed guidance will be provided over the coming months. There's actually a work group with CMS, the Centers for Medicare and Medicaid Services, by the way, that are the federal agencies responsible for Medicaid, and NAMD. I'm on that particular group as well. So we are talking through the details of what CMS is actually asking us to do. So go on to the next page and we'll talk a little bit about what that guidance said. The policy effective dates must comply with FCRA, the Family First Coronavirus Response Act, which allowed us to get the enhanced funding if we left people on. There's a lot of pending eligibility enrollment work that needs to be done, and it has to be completed in the 12 months after the public health emergency ends. So if we assume, and we are assuming, that the public health emergency will end at the end of December, we will have until the end of December 2022 to complete all of our work necessary to renew and update all of these cases. The big change, not in addition to those 12 months, which, by the way, the previous guidance had said 6 months, that would have been a very short period of time. It would have actually created a bubble in the work that our income maintenance agencies are asked to do around renewals. It was, in many ways, very unworkable. The other thing is a renewal, meaning a redetermination of eligibility where you ask you either gather or ask for information from the member about their case, and you do a complete review of their case, must be completed for all healthcare cases prior to taking any adverse action. So what does that mean? That means if you had an income increase and you reported it, let's say you're on food share, so you reported it, and it would make you ineligible for Badger Care. On January 1st, we can't just go in and run eligibility and make you ineligible. Okay, what CMS is saying is we have to go through the whole renewal. We have to complete the redetermination. So we will, and we'll talk about this in a second. Let's go to the next slide. That'll help me talk through this. Let me, before I get into how we're going to do it, let me talk a little bit about more of the guidance. We have to take a risk-based approach. By the way, they're very flexible on what that actually means. We could and should and consider adopting new flexibilities that streamline eligibility, especially for children and dual eligibles. And we should create efficiency by combining actions. Don't worry about that. We got that one covered already. We have an integrated system, and we plan on aligning our healthcare and food share renewals. So go on to the next slide. Here we go. We are developing our plan right now. Remember, it will take place over 12 months. We are determining how we will split up all of those cases and individuals across the whole 12 months and doing all of their renewals. We will have to include in our plan any policy changes, things that we weren't doing that we now have to do, process changes that might be necessary. There'll be systems changes, and there'll be lots and lots of member and stakeholder communication. This really needs to address the impact that this has not only on our members, but on our managed care plans, the HMOs, the MCOs, and on other providers, and actually on our income maintenance agencies as well. those income maintenance consortia and the Milwaukee Enrollment Services, we need to make sure that this is a workload that they can do it in a timely, efficient, effective manner. That's the reason I really welcome the 12 months to do this. Next slide. Our goals when this comes along are to minimize the negative impact of unwinding on members, to proactively collaborate with stakeholders. We want everybody to know we aren't in this alone, and they aren't in it alone. We're going to work on this. We're going to collaborate, and we're going to coordinate our approach so that we aren't duplicating effort when we can, and make sure we don't have any gaps. So, you know, a lot of my job is to make sure that we minimize overlaps and we eliminate gaps when it comes to our policies, our processes, and our systems changes. So that's one of the things we'll be doing. We also need to make sure that we have as simple approach as we possibly can. We're going to need to explain this to a lot of people. That's what we keep on saying. And we need to make sure that this is simple to understand. So it can't be a really complicated algorithmic thing. It's going to have to be very straightforward. And then again, we need to really plan, communicate, and distribute the workload to make sure that we don't get a big bubble in our work, the so-called pig in a python. We do not want that. I've lived through senior care, don't want to see that again. And we always have to comply with federal policy and make sure we're meeting quality control requirements, including the payment error rate measurement process called PERM that Medicaid does. We just got to make sure that we minimize our exposure to committing any errors that could come back to bite us. Next slide. When it comes to minimizing the negative impact of unwinding on members, we need to minimize, of course, the number of people who lose coverage. And so we're going to try and expand to the extent we can administrative renewals, sometimes called ex parte redetermination, where we use other sources of data to determine whether someone has remained eligible, and we don't need to reach out to other than confirm the information that we've gathered. That won't be true for everybody. There's a lot of people that are going to have to go through the process. We're going to be sure to give members as much advance notice as possible before we change their benefits, making sure that they know when the renewal is. And we need to ensure that members know that if they aren't eligible for Medicaid or Badger Care anymore, that the marketplace does exist for them. And there may be other health coverage that's out there that might also be appropriate. So next slide, to the goal 2. On to goal 2, proactively collaborate with all of you. We need to make sure that we're all on the same page, that we're making sure that our members know how they can maintain their coverage through Medicaid, Badger Care, the marketplace, or any other insurance. We need to make sure that you are aware of everything that we're doing with as much advance notice as possible, and that you're involved in actually setting up the processes that are going to be necessary to get through this whole process that we have. So next on to the next goal, I believe. Oh, thank God there's a goal 3. We also need to make sure we simplify the changes again. So align the dates of policy changes, for example, reinstate the MAP work requirements. At the same time, we put the MAP premiums in place. We can't do them separately. And then the other thing is we really need to align our healthcare and food share renewal dates for people who are enrolled in both programs, which is a large percentage of the people in our program. And if it's not, we need to increase that number, by the way. So we need to make sure that we use the food share renewal date as much as we can to spread out those healthcare reviews and to make sure that people aren't doing multiple things. The last thing I'd mention in this goal is the number one thing we're really going to need to do, and I'm going to keep on saying this, we need to get address, email, phone numbers updated. If we don't have those, those particular, those ideas in place, it's not going to work as well. We're going to have a hard time reaching out to people. So next slide, Michael. Goal 4 is to plan, communicate, distribute the workload. We don't want to have spikes in our renewals due each month and have backlogs in income maintenance agencies and have people losing eligibility. This is the pig in the python program that I've talked about already. So we can go on to the next slide. Goal 5 is, again, comply with the policy and QC requirements. We can move forward. This is really just meant to focus on keeping our exposure to a minimum. So next slide. The timeline, the unwinding start date is completely dependent on when the federal public health emergency is ended. And so we expect that to be December 31st, 2021. However, with the Delta variant, I've heard the Lambda, the Mu variants are apparently bearing down on us as well, we will have to wait. At a minimum, we know that CMS and the Department of Health and Human Services will give us at least 60 days before to know when the unwinding is going to happen. We've asked for longer. We've asked for 90 days, 120 days, as much as we can get. But they are allowing us a full 12 months to complete all the pending eligibility and enrollment work. And we've been talking and planning for this for a while. And we're beginning our work group now to collaborate with everyone else so that we can gather all the different viewpoints and set up a process that's going to work for everybody. So on the next slide, please. Again, ending of continuous healthcare coverage at members next renewal. Again, we'll distribute those healthcare renewals evenly as much as we can. We're going to align with food share as much as we can. Otherwise, we're going to seek to minimize the amount of time someone has gone without a renewal. So we're probably going to go back, is our plan right now, to go back and look and see when their renewal was back in April of 2020 and maybe move that up. But we're also looking at maybe there's a couple groups that we want to keep on and make sure that we have adequate time to do the renewal that they have. So on the next slide, please. There are some other Medicaid changes that are planned for 22. We aren't exactly sure when these are going to be put back in place, but one is we're going to reintroduce premiums for MAP and the Badger Care Plus children that they pay. We're going to reintroduce the MAP work requirements at the same time as the MAP premiums. That was a change that was made in the budget prior to when this administration was elected and came into our offices. And we're going to be ending the expansion of presumptive eligibility for the elderly, blind, and disabled at the end of the PHE. We're not allowed to continue it under either state law or federal law. On the next slide. There's also things going on in food share. So food share is what was once called food stamps. This is now the Supplemental Nutritional Assistance Program, or SNAP program. There were a number of changes that occurred that really helped out our state and helped out our members and helped out the people of Wisconsin and everybody in this country. There was an increase of 15% that was done earlier this year to the amount that individuals received. That will be ending in October, but we're also putting in a new 2021 cost of living allowance increase that the Food Nutrition Service has communicated with us that will make up for most of the loss of that increase. We'll also be restarting the renewals and the 6-month reporting forms, the SMRFs, on a rolling basis in 2021. That'll be happening this fall. We'll be reintroducing the requirement for interviews because our waiver expires at the end of October. And then we're going to be ending emergency allotments based on when the state and federal public health emergency end dates, which right now is December 31st. So right now, food share members are receiving the full maximum allotment regardless of their income each month. And that's been very helpful to many, many people, including not only our members, but also the grocery stores and everybody else. It's also great money that's really infused a lot of economic activity in our state budget. And at this particular point, it says date to be determined. I'm guessing it's 12/31, but please stay tuned to what the Department of Health and Human Services Secretary declares, and we will be following suit at the Department of Health Services. On to the next slide. More food share. We have to reintroduce drug testing for individuals with a drug felony. That's a requirement of federal law. We have to reintroduce work registration sanctions for those people who are mandatory and refuse to register. That'll have to be reintroduced, and we are going to have to change our eligibility rules back for students. As much as I wish the federal government would change the rules for students and allow more of them to receive benefits, we will have to shift back to our pre-pandemic eligibility rules. Next slide, Michael. Thank you. Okay, changes to request verification in most situations were implemented in July 2021. We're going to have to go back to our previous verification requirements, and the processing of pandemic unemployment insurance payments for eligibility determination on an ongoing basis through February 2022. Just one of those things that we have to take care of. Next slide. Okay, there is a Forward Health Community Partners website we want you all to be aware of. There are resources there for partners, including handbooks and policies and updates. You'll link up at this place that we're showing you to subscribe to the Forward Health Community Partner listserv to receive unwinding and other program and policy updates. Great way to stay connected. Again, you can read it here. It's dhs.wisconsin.gov/Forward Health, all one word, /partners.htm. You get there, you can see all of the different materials that are available to you. Next slide. Now, we've talked about the public health unwinding. I want to update you on a couple of other changes that are coming at you soon. Let's talk about access and what we're doing with that. Next slide. Both the Wisconsin Department of Health Services and the Department of Children and Families are engaged in ongoing efforts to modernize access to enhance and simplify benefits management. Access is, of course, a primary way that people can apply and manage their enrollment for our Medicaid Badger Care, for Food Share, for the Wisconsin Shares Program, and for W-2 and other employment programs. It's a nice online tool. It's been copied around the country, but it's never was really modernized and updated. So next slide. In February 28, we updated the front end of this, and we helped out with the see if you can get help, what I used to call Am I Eligible? And we've tried to modernize the way this looks. We've actually moved it into new software. And then at the end of October, the next month, I guess, we're going to be updating the Apply for Benefits whole application so it's easier to use. One of the nice things about it, honestly, is we're moving to what's called responsive web software that allows individuals to scale the website to their phone, to their tablet, to whatever machine they're using to view it, which will make it easier for people to use. And we're also making some changes to document submission to make it work better. Next slide. The Access websites, new design. It's more flexible in completing sections. We've been listening to feedback for a number of years, and we're making these updates. Both the application and the tool for submitting applicants are going to be supported on mobile phone browsers, some things that were not done before. We've changed a lot of the way that the language that's in it, so it's much more conversational, much easier to understand, and the help text that we have is more visible now when you use it. And we're also providing more opportunities for our users to give us feedback on their experience and when it comes to applying for and managing their benefits, so we can continue to make changes to our website on an ongoing basis to make it useful and a trusted source of help for our members and for those people who are interested in our programs. So next slide. The easier document submission, we've really redesigned the tool to make it easier to submit documents, to make it clear for what documents are required and how to submit them online. And applicants can get the document submission tool through the Your To-Do list on their account homepage. So it's a nice way of kind of taking that verification checklist we've always had and making it sort of connecting it to the document submission. Next slide. Access applications that were started or submitted before October 30th will be impacted by the updated Access website. We're asking applicants to complete and submit any of their unfinished applications by October 30th. Applicants should call their income maintenance agency if they need more information about their Access application. So we need, if you started in the old version, you need to finish in the old version, and then it will immediately switch you to the new one. But if you're caught in between, that could cause some issues. And I will talk, if you have questions, we can provide you with answers about that. Next slide. If you want to learn more about this, we're doing a webinar called A Preview of Website Enhancements on September 20th. Maciel and Daniel Yang are going to be doing that on September 20th at 11 a.m. Please sign up for it. Please listen and please ask questions. Next slide. Last piece of this, the HMO enrollment tool. We've been working on this for a while. We're going to put a new in place at the end of October, a new tool that will allow you to review and select your HMO at the time that you are applying. Applicants and members, those who want to change, those who need to renew every year and decide to choose a new HMO, this tool is really meant to help them choose the right one for them. It allows you to check which doctors belong to an HMO and provides you actually with our 5-star rating system on the HMO. It allows you to compare up to 3 HMOs side by side, and it allows you to find the HMO phone number and their website so that you can go out and look at their website, make sure you understand how they work, where they are, all those kinds of things. Members can also manage their HMO participation from their Access account. So they can sign up. They can change when they're allowed to. Remember, there's a lock-in for most of the year, but they are allowed to change. This is a great place for them to use that. It'll also be used by our enrollment broker, Maximus, when people call up. Next slide. There is a provider search that'll allow people to look to make sure that their doctors, or which doctors they want, which clinics they have, are accepting new patients, and also find out which HMOs cover those particular providers. And there are search filters available for Badger Care versus SSI, Medicaid, medical, dental, et cetera providers, whether they're accepting new patients, what languages are spoken there, anything about gender or specialty. So next slide. At this particular point, I'm done with my part of the presentation. I want to thank you all for being here, for all the work that you do, and of course, for your interest in the work that we do in the Division of Medicaid Services. Again, thank you for your tireless commitment to help people in Wisconsin understand the Medicaid program, Badger Care, our other programs, and as well, sign up people for health insurance. Our goal is to make sure the maximum number of people in Wisconsin are insured so that they can get the right health care, so that when they get that health care, they can remain as healthy as possible and live their best lives. So I want to thank you for that, and then I will turn it back over to the moderator. Stephanie.
Thanks, Jim. Before we jump into questions, and we do have a number of questions that have popped into the Q&A, we are going to open a poll to see how you all are doing with this content. So just let's take a few minutes and take an opportunity to answer this poll question. And while you're doing that, I've got to kick off the questions for Jim by asking, is pig in a python a technical term? Oh, I think you are on mute.
Yes, but just so everybody knows, I charge myself $5 for every time I speak when I'm on mute. And at this particular point, I'm up to $335 for the pandemic. So it's killing me. So pig in a python is not a technical term, but is a term that we learned when we were doing senior care in the early 2000s. If you were around back then, you remember we had basically 100,000 people sign up all in about the course of 2 or 3 months. And that meant that every year we had this huge workload that we had to go through. And we do not want that to happen again. I am very proud of the fact that I've gotten the pig in the python, which maybe is not very animal friendly when I actually think about it. We've actually transferred that term over to other states and to the federal government. They're now using it.
Awesome. So it may be a technical term in the future. All right. So we looks like we have some poll results. It looks like folks are currently seeing above normal and higher than normal. So over half of all people on the call today are seeing above average enrollment caseload. I'm assuming that will probably kick up again shortly. Do appreciate your participation in the poll. Wanted to kick things off. So we have a number of questions coming in. So first, William over at Kids Forward has a couple of questions about the ex parte application and renewal process. So sure. Wondering how those are going to be used by DMS, what percentage of renewals that you anticipate to be done that way?
Yeah, we don't know. We're trying to actually expand it. So ex parte, the so-called administrative renewals, have been around for a few years. Basically what they are is where you gather data from other data sources to update your understanding of the person's situation, and then you determine their eligibility. Once you've done that, you send that information off to the individual and say, this is what we understand, is it right? If it's not, call us. So the great thing about it is it minimizes the impact on the member. Also, in many ways, keeps our workload in the local agencies and at miles a little lower. But the number one thing is it keeps more people on coverage. The thing is that it's hard to do when we don't have updated information from those data sources. So that's our limitation. If I could, I'd do it for everybody. But since we don't have that ability, we are trying right now to identify other opportunities we might have to expand the administrative renewal. Please stay tuned. Please keep track of what we're doing, and we will keep you updated on what it is and how we can maybe increase our percentage of administrative renewals.
That sounds great. All right, the next question is, assuming the public health emergency is extended in 90-day increments and could be renewed in mid-October, why are you assuming the PHE will be ended by 12/31/21? It's my understanding that this would require the federal government to end the PHE before the 90-day extension expires.
Yeah, what we've been told by the Biden administration from the beginning, almost since they were in office, was that they could assure states that it will be extended to at least the end of December. So we are acting on the best available information right now, which is it will expire at the end of December. If it gets extended, that's one bad, because it means that the pandemic continues and the rate of cases and hospitalizations and deaths continue. On the other side, we're completely prepared to move this out. If it moves out 90 days, whatever number of days it is, we can move this even further out. If we start in February, March, April, those are all fine. We'll be ready to do it, but we'll have all our planning, we'll have all of our tools in place at the point that we think the earliest will be January 1st, maybe the best way to think about it.
All right, thank you so much. The next question up is, can you clarify, will people only be at risk of losing their Medicaid whenever it's time for their annual renewal in 2022? So people could lose Medicaid at different times in the year, regardless of when the public health emergency ends.
Yeah, that's what the CMS guidance really means. If you leave the state, if you voluntarily leave the program, you'll lose your coverage. But until we've completed a full renewal, you cannot lose your coverage under what the federal guidance is. So if your income's way above the limit and we don't renew you to April, you're on until April, even if something else would occur and we might run your eligibility, maybe because of a food share change. So you will remain on the program until our renewal is completed. That is a federal requirement now.
Great. Next up is, have you heard anything more from CMS about premiums, copays, or other changes to adults without dependent children that the legislature included in the Badger Care waiver, which have been paused during the public health emergency, and enhanced FMAP requirements?
CMS, we are actually asking that question right now. We're asking, when should we be re-implementing the two pieces of the Badger Care Plus reform waiver, which is basically premiums for people above 50% of poverty, and the treatment needs question that asks people, do you have a substance use disorder problem and do you want treatment? That question must be answered as a condition of eligibility. How you answer it does not affect your eligibility. But we are talking to them about when can we implement this? When should we re-implement this? How does this affect the Badger Care reform waiver end date? So there's a lot of outstanding questions that I'm sure we want to know just as much as you want to know how CMS is going to react. We will implement it based upon what's required in state law and, of course, what our federal guidance provides us.
Thank you so much. All right, the next question, for tribal members, will there be a withdrawal tool for the HMO enrollments as well?
Tribal members, if they identify themselves as tribal members, will always be seen as optional. So they will be given the choice of enrolling in an HMO if they want to. They will be told that this is an option for them, and they will not be automatically enrolled if they, one, identify themselves as a tribal member, by the way, in the application, but also if they don't choose an HMO, they aren't going to be put in an HMO.
All right. We got a couple more, and then I think we're going to turn it over to our next panelist. Keep those questions coming because I'm sure we'll have some time at the end as well. We wanted to catch some of these because it was a lot of content you presented, Jim. So do you need an access account in order to use the HMO search tool online? So can someone without an access account still go to the website and see if their doctor is in network with a certain HMO?
I do not know the answer to that question, but it is one that we will take back and get an answer to.
All right, next question. I listened to what you're saying, and it sounds like you believe there should be collaboration between DHS and the providers, but my experience is that is almost adversarial. We're all trying to assist our vulnerable and hope that you and your team can work with those at call centers to be partners in assisting clients and patients. It also seems that many of the staff are not fully versed in different applications. So this is more of a comment than a question.
Yep, that was more of a comment. Thank you for your comment. We will take that back. Our plan is to be as collaborative as we can possibly be with everyone, to take everyone's input. And the duty of everyone who's involved in this system is to make sure people who are eligible are enrolled in the right program at the right time, again, for the right benefits.
And if folks are finding additional needs for collaborations, where best could they share those concerns? Would that be with their partners?
I think that would be a great place. I also think that's something we should talk about internally and make sure that people understand that there's a point of contact that we will have, and we will make sure that people are aware of that point of contact.
Great, thank you. Last question before we go back to the presentations. Has there been any talk regarding ADOA and it being considered a disabling condition? Or I'm guessing AODA.
Okay, I remember. Okay, that was an old term. AODA used to be the way we talked about it, but now we call it substance use disorder. It was weird in the 90s, and remember, I've been around here, it seems like forever. In the 90s, Congress actually made substance use disorder, or AODA, it cannot be the primary disability determination when it comes to determining whether an individual is disabled. This happened at the same time they made all those changes in immigration status and made more people ineligible for 5 years, et cetera. So at this particular point, I have not heard of any discussion federally, which is where these rules and these laws are, to change the definition of disability. As much as I think that's worth looking at.
Great. Thanks for fielding all of those questions as the starting point to this. I think what we would like to do is turn it over to Nathan, and Jim, if you have a few minutes to stick around, we might have some more questions for you by the end, maybe both questions for both of you by the end here.
I wouldn't miss it. I wouldn't miss it. Nathan talking, right. I'm in.
And I did skip the question, but we will want to know about who you charge for your talking while on mute. So that's another riveting question in the chat box there.
It's me. It's me. I have to pay it, and the money's going into a fund to provide some help for our division.
Excellent. All right. With that, Deputy Commissioner Hodak, do you want to take this over?
Sounds good. Thanks, Stephanie. Can I get a thumbs up that you can hear me? Okay, good. Well, fantastic. Thanks. Good morning, everyone. I am Nathan Hodak, Deputy Commissioner at OCI. So I'm going to be providing kind of a perspective on some of the similar themes that Jim touched on, but obviously from more of the OCI perspective. Mike, if you want to forward the slide, please. So that gives you an overview. I'm going to touch on some state and federal policy action that we've seen advance to increase healthcare coverage, access, and affordability, as well as some of the work of the Healthcare Coverage Partnership and some successes that we've seen from that work. Before we dive into that, though, I want to spend a couple minutes just kind of talking about OCI's response to the pandemic and some actions that we've taken over the past year. So last March, like a lot of other businesses, agencies, organizations, OCI pivoted to remote working, and we did our best to really adapt to the virtual environment as quickly as possible. One of the things we did is we made remotely proctored agent licensing exams available. And we also temporarily waived continuing education requirements until June of last year to ensure that everyone really had time to adjust with no unnecessary penalties. We know that navigators and CSCs are really critical to health insurance access. And so we work to make sure that these important on-the-ground staff were able to serve consumers looking to get covered during the public health emergency. And as with almost every organization, obviously 2020 and 2021 presented unique challenges for us as an agency, but we really did our best to support Wisconsin's insurance industry across the board as really faced a lot of unprecedented challenges. Since March of last year, we've actually issued over 24 bulletins to insurers to keep the industry up to speed on the changing regulatory requirements and flexibilities. And to put that in context, in a typical year, OCI will issue around a half dozen or so bulletins. So we were very aggressive, obviously, with our communication in responding to a lot of the events of the pandemic and a lot of the flexibilities that had to be put in place. And what we saw is, by and large, many health insurers really stepped up to cover testing and treatment and vaccines appropriately, and as well as a voluntarily expanded telehealth that offered premium holidays and provided other flexibilities. And now, as we move forward, we're all aware that obviously the pandemic isn't behind us yet, and there are now new challenges facing the health insurance industry and our agency. And we really continue to rely on input and feedback from our entire stakeholder community so that, we, from a regulatory standpoint, know what action to take and, where action is needed, what are things we need to be thinking about, because we really want to support our state's recovery and really ensure that Wisconsinites continue to have access to healthcare coverage. And we know that the pandemic has really made it more clear than ever that access to quality healthcare is critical to the stability and security of our state and obviously all of the residents of the state. So, okay, Michael, yep, you can leave it on the Badger coverage plan slide now, that's great. So one thing I want to talk about, this was actually a proposal that was included in the governor's budget. Given some of the other high profile items in the budget, as well as obviously what's been happening with the pandemic, there wasn't really a lot of attention paid to this proposal, but it's something I want to talk about because it really was a bold new approach to working to expand access to coverage here in Wisconsin. So the plan was really built around three main kind of pillars or parts. The first being expanding Medicaid, expanding Badger Care up to 138% of the federal poverty level. The second part of the Badger coverage plan would have created a health insurance premium assistance program for Wisconsinites earning between 138 and 250% of the federal poverty level. And this premium assistance would have made it easier for lower income individuals in that income range to access silver plans at the same rate as bronze level plans. One of the things that we've seen, and I think we're all aware of, is a lot of folks in that income range might have health insurance coverage, but they might have it at a bronze level where the out-of-pocket and cost-sharing requirements are prohibitive for actually accessing care when they need it. So the governor's proposal would have actually created a state-level premium assistance program to really help folks buy up from bronze to silver in that 138 to 250% of federal poverty. And then the third component of the Badger coverage plan would have been to transition Wisconsin from being on the FFM to being a state-based exchange. And I won't get into all the details of that now. Obviously, that could be a whole discussion unto itself. But as we looked at that transition and what other states have done that have transitioned to a state-based exchange, we really found that there were a lot of benefits in terms of streamlined eligibility, access to better data that would allow us to do more targeted marketing and outreach, as well as the cost savings to the state and the ability to establish our own open enrollment and special enrollment periods. And also, as part of the governor's budget and kind of part of this overall healthcare access package that was in the budget, the governor would have provided additional funding for navigators to really help expand access to coverage and support those important outreach and enrollment efforts. Now, unfortunately, these items, both the items including the Badger coverage plan as well as the navigator funding were removed from the biennial budget bill by the Joint Finance Committee. However, the governor was able to provide $1 million in CARES Act funding for navigators. And obviously this year, just a few weeks ago, we saw the announcement from the Biden administration that an additional $80 million is being provided nationwide for investments in navigators, with just under $2 million here in Wisconsin. So we think that's fantastic. Next slide, please, Michael. And then staying on the federal action, we've seen a lot of activity, obviously, going back to last spring. The passage of the CARES Act was really a significant step towards stabilizing our state and really our overall country, really during the beginning of the pandemic. And now this year, we've really seen ARPA has made a particular impact on healthcare coverage access. And I think everyone is probably aware that ARPA, or the American Rescue Plan Act, has provided enhanced subsidies to allow thousands of Wisconsinites to access health plans at a more affordable rate, and in some cases for a $0 premium. And really, while it's not apples to apples, what ARPA is providing in terms of enhanced subsidies is very similar to what the governor's Badger coverage plan was trying to achieve to get people better coverage and provide subsidies, especially for folks at the lower end of the income spectrum. So, ARPA capped the marketplace health insurance premiums for benchmark plan at no more than 8.5% of household income. It also eliminated the income cap for subsidies through the end of next year, meaning that people with household incomes above 400% of the poverty level will be eligible for subsidies during that time. And for people with lower income, the normal percentage of income that has to be paid for the benchmark premium has been reduced really across the board. In Wisconsin, we estimate about 52,000 uninsured Wisconsinites will be newly eligible for these enhanced subsidies, and about 32,000 uninsured Wisconsinites are anticipated to become eligible for the $0 benchmark marketplace plan. And people receiving unemployment benefits in 2021 are also eligible for premium-free benchmark plans and full cost-sharing reductions through the end of this year. So really, we've seen with the passage of ARPA, in addition to the opening of the special enrollment period, it's really had a significant impact on healthcare coverage enrollment in Wisconsin and across the country. And I'll go into some of the numbers in a few minutes here. But in Wisconsin, the successes of ARPA have really been amplified thanks to the work of the DHS OCI Healthcare Coverage Partnership. Next slide, please, Michael. So we know, this is obviously something Jim just touched on, that as the local executive orders expire and the federal public health emergency eventually ends, it's really going to be important that we're prepared to support consumers that will be transitioning into new healthcare coverage, whatever that coverage might be. And we are working closely with all stakeholders involved with the partnership to really make sure that this post-pandemic transition is successful. Obviously, Jim provided extensive information about what's being done on the DHS and Medicaid side, but we really see this as a hands-on, all hands on deck effort to make sure that people are able to transition smoothly. And we're really grateful to work with organizations like Covering Wisconsin as part of the Healthcare Coverage Partnership. And we know that it's because of the work of these important partner organizations that we've been successful in raising awareness among consumers, connecting the dots between providers and payers, and making health insurance more accessible really overall. We all know that the more we educate consumers, the more likely they are to sign up for coverage for the most part. And working families really need to understand their coverage options. And we're committed to making sure that those folks are prepared to select the health insurance plans that work best for them and their families. And that's really where the partnership, the Healthcare Coverage Partnership, comes in. This partnership began in 2019 under the leadership of the governor, and it's really focused on connecting the dots between our work at OCI and DHS in order to support the efforts of the regional enrollment networks and really the people who have been the boots on the ground doing outreach and enrollment every day for a number of years now. And our focus continues to be on closing the healthcare coverage gap and getting Wisconsinites enrolled in the coverage that's right for them, whether that's marketplace, Medicaid, employer-sponsored coverage, whatever it might be. We just think closing that coverage gap and getting people enrolled is the main focus. And the partnership was really created with several goals in mind. The first being to support outreach and enrollment initiatives focused on educating consumers about their coverage options. The second is to engage with stakeholders, including consumer and community organizations, health insurance companies, healthcare systems, et cetera, to really guide the partnership's efforts to strengthen healthcare and health insurance markets here in Wisconsin. Another goal is to work with members of the legislature, federal official, and any other important partners and stakeholders to advance the governor's proposal to expand Medicaid. And finally, we're focused on promoting health and reducing costs for Wisconsin families. The partnership really supports individuals with Medicaid coverage and helps individuals smoothly transition from Medicaid to private coverage whenever it's appropriate. And through the partnership's various work groups, we've been able to really break down these goals and the overall kind of work of the partnership into some achievable goals and to really begin to make some real progress. Next slide, please, Michael. So I'm sure most folks have seen the number that during the special enrollment period this year, just over 33,000 Wisconsinites got enrolled in coverage, which is fantastic. We saw just under 120,000 people actually updated their coverage and resulted in reduced premiums for those folks during the special enrollment period. And overall, as of July of this year, there were just over 201,000 total members enrolled in the ACA individual market. That's both on and off exchange. And as we look at our 2021 average marketplace enrollment, we're expecting that to be around 197,000, which is roughly 15,000 more enrollees on average than we had last year. And many of these enrollees were encouraged to get coverage through the work of the partnership, and we think that's fantastic. One of the other things that we're very proud of is the work we did to successfully develop the wiscovered.com, which was rolled out in 2020 and has served as really a critical resource for consumers who are considering health insurance and then helping those folks get connected with navigators. The site was designed and built by our team here at OCI with the assistance of the Partnership Marketing Work Group, and it was really designed to be accessible and effective for Wisconsin residents in every corner of the state from all walks of life. Wiscovered is a mobile-first website, meaning that it was designed to work best on smartphones, really focused on Wisconsin residents who may not have access to a computer or who lack access to the internet at home. And the site is available in English, Spanish, and Hmong. Between June 1st of last year and August 15th of this year, we've had tens of thousands of users interact with Wiscovered. During that time, we had about 20,000 users visit the page with approximately 30,000 page views. And just under half of the traffic, about 46% of the traffic on wiscovered.com actually originated from social media. And this means that our social media content is helping to drive consumers to take direct action with regard to their healthcare coverage. Now, this data is still very limited, but it does provide us insight into the fast-growing success of this resource, and it really highlights the growth potential to reach more people through this platform. And we're now looking ahead and plan to rely on wiscovered.com as a core resource for the 2022 open enrollment period. Next slide, please, Michael. Now, as we look ahead to the open enrollment period, our team here at OCI has already developed some open enrollment toolkit content and messaging, which we'll be posting and promoting throughout the open enrollment period. Our communications team continues to rely on the expertise of groups like Covering Wisconsin in coordinating with other members of the partnership to ensure that our open enrollment content is effective and engaging. And as you can see on the slide here, these are a couple of the examples of what's been put together so far. And when the open enrollment period begins, all of the materials will be available for any interested stakeholders to access. And I believe, Michael, I don't know if the graphic on the left, no, if you could go back to the previous slide. If you scroll over the graphic on the left, I think you can actually play it. No? Maybe that functionality isn't engaged. All right, never mind. That's a little video. When it's posted, you'll be able to see that the graphic on the left is actually a little video that plays. So next slide, please. So that's the end of my remarks. I just want to highlight that we'll continue to work over the coming months to really support consumers as we navigate the COVID recovery and continue our efforts to expand healthcare coverage. Just want to thank everyone again for your engagement on this important issue and for inviting me to be here today, and really appreciate all of the work and support in this important effort, and look forward to continuing to work with all of you.
Thank you so much, Nathan, for your comments and your presentation today. I wanted to do the same thing we did right after Jim's presentation and open a poll for the audience participation. So please take a few moments and just go ahead and give your response to this poll. All right, Michael, did you want to share the results of that poll? All right, good news, good news. 82% of people understand this unwinding of the public health emergency, so that's good news. So questions coming in from the chat. Feel free to keep your questions coming in through that Q&A button on the bottom. But a couple questions for Nathan right on the top here. With the income cap being raised, does anyone know if the IRS is aware of this? On their website, they still state full payback of subsidy if over 400% of federal property.
That's something I can't directly speak to, but I can definitely talk to our team about maybe reaching out to the IRS to find out why that information is still there.
Thank you. Also, when do CACs need to have their testing completed this year to help consumers enroll in marketplace insurance?
You know, that's a good question. I don't know the exact answer to that. I'd have to talk to our team internally. I don't know if Allison or someone else has that information.
Yeah, thank you. And it looks like Courtney is going to be typing an answer there. For sure, the person on our team that can help you, guide you through that is Shannon Drake Burr. And, you know, for sure you want to have all that done before open enrollment starts on November 1st. But yeah, Shannon will be, can be contacted to give more specifics.
So obviously, just a question for both of you. Over the last year, one of the sort of benefits, I guess you could say, of this situation we've been encountering is less churn because of the maintenance of enrollment efforts, and also additional affordability of marketplace plans. So what are your predictions, both Jim and Nathan, for what folks in the field can be expecting when those things both start to change?
When it comes to what's going to happen when the public health emergency is, we aren't really sure yet, because while we do have some data on some people have reported some changes. We could be losing some of those individuals. A lot of people haven't reported their changes, so we aren't really sure. I think it's important to note that we started off at about 1.1 million people in the program, and we ended up at almost 1.5 million people. So I think we added some 380,000 people or something. So that's a lot of people, and that's a lot of people who joined the program who probably wouldn't have. Our numbers stay pretty consistent depending on the economic times, but if economics remain relatively consistent, we end up at about 1.1 to 1.2 million. So we could see, you know, the loss of a lot of people, but when I say the loss, I mean that would just really be a transitioning hopefully from Badger Care or Medicaid into the marketplace. So I don't have a number for you. I don't want to venture a guess. I have behind the scenes, you should know. I have a square in the pool, even though we don't have a pool. But my best guess, I'm going to keep to myself for right now.
And it's a great question, and you know, to Jim's point, it's one that we really don't have definitive answers to at this point. You know, from the marketplace standpoint, we have a good sense of what 2022 is going to look like because the subsidies will continue to be in place from ARPA. You know, we continue to see the market overall being stable, the individual market, largely thanks to the healthcare stability plan or the reinsurance program. We also, you know, secured an additional 30 million for that reinsurance program in the budget for plan year 2022. So that helps, again, buy down some of those high cost claims. I think, you know, as we go into next year, the question, as Jim mentioned, will be, you know, those folks who are transitioning off Medicaid, what is that going to mean in terms of enrollment impact in the individual market? And then for us, the big question is, what happens if the ARPA subsidies do not get extended past next year? What does it look like as we're going into 2023? And that's, you know, that's where I think the big questions are that we don't have answers to at this point.
Great. Well, I appreciate you both fielding that question. Another question for Nathan. Do you see any path forward around the state-based marketplace with this administration in this current environment, given the budget and how it landed?
You know, The short answer is I do. I mean, I'm more optimistic about there being some degree of bipartisan support to transition to a state-based exchange than there is around, frankly, a lot of other health policy proposals. Similar to what we've seen with the healthcare stability plan and the bipartisan support around that program. You know, I know some of the majority party members in the legislature have expressed support for a state-based exchange. I know we've seen in other states, Pennsylvania is a prime example, where they have you know, Democratic governor and Republican-controlled legislature, and they were able to come together and pass enabling legislation to transition to a state-based exchange. So it is one of those areas where there is some bipartisan alignment in terms of making that change. Now, as with all things healthcare and health policy, the devil is in the details. And while in general, I think everyone or a lot of folks might be on the same page that it's beneficial to make that move to a state-based exchange, there are a lot of questions around you know, how the state-based exchange would be structured, the governance structure, plan management, where it would be housed, timing of the transition. So just a lot of details that would need to be worked through.
Great. A couple, looks like there's another question in for Jim. Is the $8 copay for non-emergent use of EDs still included in the waiver?
Yes, it is.
All right. I do see a question or a comment, I guess you could say, from Shannon, who has some recommendations about where DHS can, where folks on this call can offer any suggestions or notifications around reoccurring problems. So that is included in there in the Q&A box. And then she also has some additional information about when new certified application counselors should have completed and passed their navigator exam. Another question that just popped in: if the health emergency continues for another year or two, would the unwinding be put on hold then? Being that many thought it would end last summer, but here we are.
It will end when the Department of Health and Human Services tells us it will end. So we are under the Family First Coronavirus Response Act rules, and also under legislation that was passed by, you know, in, I guess it was 2020, April 2020, by the legislature and enacted by the governor about this. As long as there's a public health emergency, federal public health emergency, those rules are in effect. We will put our plans on hold. We will put them in it won't be even a file cabinet. I'll keep them on my desk. And when we find out the public health emergency is finally ending, and God, please don't make it another year, just because it's a really long time for the pandemic to continue, we'll abide by what the rules say, and we'll implement, you know, we'll have those in place.
Great. A couple other quick questions that had come in, Jim, around the access application in terms of making it more user-friendly. So it sounds like the application itself is going to be sort of switched over to a more conversational tone. One question was, will the phone application language with the consortia also change?
It's something that we'll make sure that, I don't know the actual answer to that question, but I'll make sure that people are aware of that as a request and see what's actually happening. I'll talk to Jory Mundy, who's the director of the Bureau of Eligibility Enrollment Policy. So I'll talk to her.
Great. And then the other piece of that question was just around the written notices sent to members and whether those might be simplified as well.
Those are one of the big things that we're going to be doing in 2022. We are going through another redesign of the Medicaid and food share notices of decision. It's one of our big projects that we're planning for next year once we get past this unwinding project. And we will jump in. And the idea here is to not only explore how the notices of decision are written or letters are written, but literally how we communicate, period. So what's the best way to communicate with our members? What's actually required by federal and state law? But also, again, what's the best way to communicate? And how do we get information from individuals and to individuals in a way that is comprehensive and comprehensible? So that is a project that we are going to be undertaking. It will not be a short-term project. It's a huge undertaking, but it is something that we've committed to do in 2022.
Great. Thank you very much. All right, since we are getting close to the end of our time here today, I wanted to close with a final question for both of you. The question will be very similar. So for Jim, it's going to be, what's the main message you'd like enrollment assisters, all those folks on this call today, to convey to Medicaid members this fall? And for Nathan, it's going to be same sort of thing. What's the main message you'd like these folks on this in this group today to convey to people with marketplace coverage this fall? So I'm going to turn it over to Jim first. What's, if you were going to put everything in a bow?
I'll give you, I got two messages. The number one message, and the thing that keeps me up at night, is not having good contact information for our members. Make sure that people are aware, if you've when you're talking to someone who's on one of our programs, make sure that your address is up to date with your income maintenance worker. Make sure that your email address, if you have one, is up to date. Make sure your phone number is up to date so that we're going to be able to reach out to you and we're going to have the right information. The second thing is, it's going to take all of us to work together, and I'm talking about the members and us, to make sure that people don't lose coverage. And so encouraging people to act when and watch the mail when they are getting notices, and take action if they need to stay on the program. And also assure them that if they can't remain on the program, that one of the things that we still want them to complete the renewal, even though they think they're not eligible, because we can pass that information to the federally facilitated marketplace automatically, digitally. And then we can see if they can be eligible for the federally facilitated marketplace, especially the premium subsidies and the cost sharing reductions. So complete the process, complete the process, complete the process is my big message.
All right, so Nathan, your turn. What's the main message you'd like all the folks on this call today to take away in terms of what you'd like them to know about marketplace coverage when they talk to folks this fall?
I would piggyback off everything Jim just said. I mean, with all of the enhanced subsidies as a result of ARPA, there's never been a better time for people to shop around and find a plan that works for them and their family, as well as the fact that, you know, we now have 15 carriers in the individual market in Wisconsin. We have more plan offerings in almost every county than we've had almost since this program was created. So even if people have shopped before or looked for coverage options before, and they haven't found anything that's affordable that works for them, this time, you know, this is the time to do it again. This is the time to go out there and look at what options are out there, because there are some really affordable, good options for people in every corner of the state.
Thank you. All right, to wrap up our session today, I just wanted to remember back 10 years ago when this all came to pass, and we were all talking about this enrollment win-win. So regardless of what everybody thought was going to be the best way to get people enrolled, we thought yes to all of it. So really appreciate both of you being on the call today to talk about how we can continue to close those gaps and make sure everyone who is eligible and can get coverage in some way, shape, or form can get coverage, and work together to make that happen. So again, really appreciate your time and your presentations today. Really rich discussion, and thank you again.
Thank you for having us.
Thank you. Appreciate it.
Yes, thank you so much, Stephanie and Jim and Nathan. Fantastic to have you all. Really, really great discussion. We're going to go into a break now before the next session, which actually, Jim, you already identified. It's going to be with Maciel and Daniel to talk about those access updates and to really give you a lot more in-depth information on that. And a couple other items I just wanted to follow up on. Tomorrow morning, I hope to share a little bit more about the DHS OCI partnership that was referenced, especially by Nathan, and just as an opportunity to be able to share back ideas and thoughts about what you're seeing on the ground with state agencies like OCI and DHS. So we can share more information about how to get involved in those. It's completely voluntary and anybody can join and participate. And we'll also continue to share information about the training and licensing. Obviously, there was a question here, hopefully that answered your question, which Shannon shared. basically what it comes down to is if you can help as soon as you get trained and licensed. And if you want to help at the start of open enrollment on November 1st, then getting all of your training and certification done by that time. And I know there was one mention of the October 1st date. That's really just for navigators in the federal training, getting that piece completed by October 1st. Everybody else, you have a little bit more latitude, a little bit more time. But again, if you want to be there from the get-go on November 1st is really finishing up before then. Okay. Well, thank you, everybody. We will take a short break. We will be back here at 10:45. Keep this link open. It's the same link. And we'll circle back and start on our next session at 10:45. Thank you again.
All right. Good morning, everybody. I hope you enjoyed that first session. I thought it was really nice in setting the tone. So thank you, Allison and Jim and Nathan for doing that for us. There's a lot to talk about, obviously, and with transitions, they're constant. We know this. We've been doing this for a long time. And that is also true for things like Access, which we'll be talking about at this session. Access being the platform that we do a lot of our work in Medicaid as we do Medicaid enrollments and help consumers in that work. And it's nice that it is kind of always a work in progress. That also means there's always a lot to talk about with it. And I have two very knowledgeable speakers today in this session for us. We have Maciel Gomez, Tom, and Daniel Yang. Maciel's been doing this work for a long time, 20, maybe 40, 80 years. I'm not sure. It's a lot. Maciel and I have been doing this together for a very long time. And I know when Maciel is on, I get tempted to ask her all kinds of DHS questions. Hopefully people can keep it to their Access specific stuff, but I will understand if you kind of veer off into more policy eligibility kind of things. It doesn't mean we can answer all of them. We'll do our best. I'm going to curate them and ask them kind of at the polling points or where else they make sense. Otherwise, we'll hold Q&A for the end. We'll also answer them in the actual Q&A box as possible. Daniel, I think, is a first-time speaker for our conference. He's certainly first for me. He is a business policy analyst or just business analyst over at DHS, which means he gets handed a lot of fun projects. And in this case, it's the Access stuff, which, Daniel, I know you've been doing a lot with processing applications and auditing applications, which means you get to see all the fun answers that consumers give or that we help consumers give on the back end to help them get their eligibility. So we are starting now, and we will go ahead. I think this is an hour, but hopefully we won't run too far over. Keep the questions coming. I'll curate, moderate, and jump in as I am able. And Maciel, you've got the slide deck, I think, right? Looks good. All right. Daniel, are you kicking us off?
Maciel will be kicking us off.
Okay.
Yes, Maciel had trouble finding the unmute button. I apologize.
That's okay. You need to pay $5 too, I think. I don't know if that's for everybody.
I don't know if Jim and I had that agreement. So.
Oh, okay. Okay.
So you can see my slide deck fine?
Yes, thank you.
Okay. Adam, thank you so much for the introduction. Good morning, everybody. My name is Maciel Gomez. I'm an Enrollment and Outreach Coordinator with the Department of Health Services. And joining me today is Daniel Yang. He is my colleague. He is also in the Enrollment and Outreach section that was newly created for the department in the fall of 2020. Today, obviously, it's already been said. Jim has said it, Allison has said it, and so has Adam. We will go ahead and be talking about some of the enhancements that has taken place with the Access program. We'll go ahead and we'll give you a little bit of background on it. We'll talk about the updates that are taking place with the Apply for Benefits section. We'll talk about the document submission section. We'll also go ahead and cover the Choose an HMO section, along with the new ability for members to be able to see the Forward Health Card in the My Access app, which is, I find, pretty exciting. And we'll also share some of the resources that we have, some helpful resources, and definitely we'll have some question and answer throughout the presentation. So please, as Adam said, please keep your questions coming. If we're not able to go ahead and answer those questions throughout this presentation, please know that he and I will work together to bring those questions back to the department, vet those answers, and coordinate with Covering Wisconsin to update all of you afterwards so that you have the most up-to-date information available as you do enrollment this year and in the future. So with that, I'll go ahead and allow Daniel to take it from here.
All right, thanks, Maciel. So session objectives. In this session, you will learn about changes to the Access website set for October 31st, 2021. These updates will make it easier to apply and manage benefits on Access. After the session, you will understand 1, the general updates being made to the Access website. 2, new functionality to help applicants and members manage HMO enrollment. 3, how anyone can search for providers and compare HMOs in a certain area. 4, updates to how applicants view documents and submit documents through Access. And 5, how members can view their For Health card on My Access. Next, please. Okay, background. Access is a primary resource for people to apply for and manage their enrollment in Wisconsin's health, nutrition, childcare, and employment programs. The Wisconsin Department of Health Services and the Wisconsin Department of Children and Families are engaged in an ongoing effort to modernize Access to enhance and simplify benefits management. And 2021 Access modernization, in February, earlier this year, we've completed See If You Can Get Help. That is the tool that users can go on the website to see if they qualify for a certain program. And coming up in October 31st, these 3 additional ones will be rolling out. We have Apply for Benefits, Choose an HMO, and Document Submission. And this is a high level for updates to the Access website. The new design will offer more flexibility in completing sections of the application. Both the application and the tool used to submit documents are supported on mobile phone browsers. Another update is a conversational tone. Questions are phrased in language that's easier to understand, and the help text is more visible on the screen. HMO choice. Applicants who could be eligible for Advantage Care Plus or SSI Medicaid can choose an HMO as part of their to-do list. We'll talk about that later. Their HMO choices will be considered if they are approved for either program. Easier document submission. The redesign of the tool used to submit documents will make it clearer for what documents are required and how to submit them online. Providing feedback. Users will have more opportunities to provide feedback on their experience with applying for and managing their benefits on Access. So users will have opportunity to provide us through surveys of how their experience is through Access. Okay, so now we've come to poll question number 1.
Great, looks like Mike's just shared that.
Thank you. What is...
Give them some time to go ahead and answer the questions. If you want to
read
Daniel,
it, if you want to read it, which go ahead, please.
Okay, I'll read it. What is not a new feature of the new Access website? More flexibility in completing sections of the application. Questions are phrased in language that is easier to understand. Clear instructions for what documents are required and how to submit them online, or allowing users to submit an electronic signature. Okay, so it looks like we have 70%, close to 70% that got the right answer. Allowing users to submit an electronic signature is not a new feature. That is something that is currently in current Access today. So I'll go ahead and close that. Great job, everyone.
Adam, should we continue or do you have questions?
Nope, you could keep going. I will stop you if I have to.
Okay, sounds good. Didn't want to continue. Okay.
You know me.
Yeah. Go ahead, Daniel.
Okay, thank you. Apply for benefits. Step 1 is create your account. As a first step, people or users can create an Access account to apply for benefits. Assuming that they already don't have one, there will be new features for creating accounts. And so we have additional password requirements, such as at least 1 special character, an email verification process for applicants who choose to provide an email address. And just to clarify, an email address is not required to create an account, but for those that do want to provide an email address, Access will send out a confirmation to the email for them to confirm. And so that is also a possibility there. And 3, I check whether an applicant already has an Access account or has already submitted an Access application for benefits. As a reminder, applicants and members must be logged into their own account when using Access. Okay, so the first page of the application displays instructions and a list of documents a person may need when applying. As you'll see here, we have documents that we will list documents that they may need, such as pay stubs, tax forms, rent or lease agreement, and so forth. If you look to the box to the right, already applied or enrolled in a program, if that's their case, they can click on the link, Find My Case, and they will log in with their username and password, and they can continue with the application or start a new application using their case. On the bottom 2 here, you'll see, let's go to the previous page. The user can either apply for themselves, that's the green button, or if we have a user applying for someone else, that person will click on applying for someone else. Go ahead, Maciel. Thank you. And for this example, if you are applying for someone else, you'll just have to indicate who you are. So if you're a staff member at a volunteer organization, you'll click on staff or volunteer at an organization that helps people use Access. And then you just click next. And once you do that, it'll take you to the programs to apply for. The user will just choose which program that's available on here. And my understanding is that this is also dynamic, which means that depending on the user and the information that they've entered, certain programs will not be allowed. They may not be allowed to apply for a certain program. So if you don't have any children, you probably won't be able to apply for childcare. But any program that's in current Access right now, they should be able to apply for, such as emergency assistance, family planning only services, food share, healthcare, and so on. Oh yeah, and one more thing, applicants can also go to the WIC, or Women, Infant, and Children Program Pre-Application site from this page. There should be a link on the bottom. And when some programs are chosen, but not others, a pop-up will display to suggest to the applicant to consider other programs which they may be eligible. And what the user what you need to do is just click on the checkbox and just add. So they have 2 choices. They can either continue without adding that program, or if they do want to add it, they can just go ahead and add that program as well. And next, once they do that, they'll come to the application overview page. This is new with this feature, and this overview page allows the applicant to choose what section of the application they want to complete. Note that certain sections need to be done before others, such as the primary applicant and household members. And once those are complete, the user can start on any section they would like. Note that the application can be submitted only with the first name, last name, and address, also known as a partial application, and that is also current functionality. So you don't need to complete the whole thing. Certain programs can be submitted, certain applications for certain programs can be submitted through this way. And to start a certain section on the application overview page, the user will just need to click the start button. Oh yes, and also on this page, on the right side, you'll see that Access will inform the user what programs they are applying for, as well as on the bottom of that, if the user decides to have someone else apply for them, such as a power of attorney or anything like that, they can also add someone in this section as well. Okay, so now we'll be going to the specific sections before we have the overview page, which lays out all the certain sections that the user can enter, such as household members, income, assets, expenses, and so forth. On this page, each section contains pages that collect information about the applicant, and the information collected will determine what programs the applicant is eligible for. Applicants don't need to complete the application in one session. And if the applicant doesn't have all the necessary information to finish a section, they can go ahead and click on the application overview, which is highlighted in red here in the red rectangle, and it'll take them back to the application overview page. There they can choose a different section to complete or edit, and later they can always return to the unfinished section to complete. And this flexibility allows applicants to complete the application over multiple sessions without losing any of the progress that they've made. And just to note that there's a 30-day window to do this. Okay, and applicants can easily track which, so now we're back at the overview page. Applicants can easily track which sections they've started and which sections need to be completed. Each application section displays a status. The status changes to completed once the required information is entered for the section. Applicants can edit the information they've entered in the application. They can continue incomplete sections, edit incomplete sections, or start a new section anytime before they submit the application. Okay, so here is an example of once someone goes into a specific section, and these are examples, page examples of what they'll see. For this case, for this example, we have assets, Ivan's money, and the Access will ask him, does he have cash, money in a bank account or savings account, and check all that applies. And once he checks those, it'll go into the more details about the cash. Is this cash set aside cover the cost of a burial, and any additional questions that are required. All these questions are current functionality that the current site is asking. It's just being reorganized in a different way. That is easy to navigate and understand. And when the user completes a certain section, they will see a summary, a high-level summary of what they've entered. And here you'll see that he's entered information, all the information that he's entered. And also another feature on this summary page is that the user will be able to edit any information that they've entered on in that section. We call it spoke. Hub and spoke, but I think for our users, it's just a certain section that they've entered, and yeah, they can always go back and make any changes that's necessary. And once that's done, they'll hit the green button on the bottom to overview, and they'll take them back to the overview page. All right, so here we are, step 6, finish and submit. And this is the last section on the application overview page. Once all the other sections have been completed, the user can go ahead and click on start for finish and submit section, and this will take them to the page where they can sign their electronic signature. They'll be reading their rights and responsibilities and any other language that's necessary or applies to certain programs. As mentioned earlier, application changes to expired, and application changes to an expired status if not submitted within 30 days. So if the application is expired, the applicant will need to start a new one. Once the user submits the application, they will receive a screen that confirms that they've successfully submitted the application, so that they know that it's complete and they're good to go. Important information for go live, as Jim has mentioned earlier, there's a cutoff date from the old site to the new platform. So so there's 2 scenarios. The first scenario is that application started, but these are not submitted before October 30th, and October 30th, which is the date that we're moving to the new platforms. If the application has been started but has not been submitted, all these unsubmitted applications will be lost. And so just kind of like an FYI, if you all agencies if you all assist users or the public for these applications, just let them know that they need to submit them by October 30th. Otherwise, it will be lost. For applications, for the other scenario, these are applications that are submitted before October 30th, 2021. And so for those that are submitted prior to the cutoff date, they will be, the agencies will receive those applications. And when they log in after October 31st, the users will receive a banner message on their account with their application status and the application tracking number. So they'll have information to let them know that their application has been submitted. And if the IM agencies processes their application, they will have an updated banner that lets them know that their application has been processed. And of course, they can contact their income maintenance agency if they have any additional questions regarding the application. Next, please. Okay, your to-do list for applicants. So after a user submits the application, they will be directed to this page. This is your to-do list. It's kind of like a follow-up, and it basically tells the applicant or the user what are the next steps. So we have a mock-up of here you'll see under Hi Ivan, your to-do list. These are options for the user for this particular scenario. It looks like he's applied for food share. He has opportunity to call to do his food share interview. And once you select on the drop down, which is not available here, it'll have information for his his agency number. W-2, for those applying for W-2, they have a link to go schedule their W-2 interview. And for those that qualify to select their HMO, they will have an opportunity to do so here as well. And also on this page, users will be able to download their application summary page here. They should be able to have that information if they want that information. The tracking number, the application tracking number is also on here as well. Next, please. Okay, poll question number 2. True or false? An application changes to an expired status if not submitted within 30 days. If the application is expired, the applicant will need to start a new one. All right, pretty much 9% got this question right. Great job. Okay, so
right.
looks like
yeah, I'll go ahead and so we've got a few that are on similar topics here. They're pretty straightforward, I think, but we have some that we might hold for a bit more discussion later. So if the application is started on the website, does the applicant have to continue for all renewals? So basically, there's a couple questions kind of around this is, do they have the ability to start the application online and then never use the website again? And in some cases, I mean, yes, if you can have it there, you can call the IM agency later. But basically, for people who aren't tech savvy, can they start the application and then pursue a different path, or how much of that information is being saved?
Yeah, good question. So yeah, you don't have to go. So once a user, let's say, starts an application and submits the application goes through to the agency, and the agency will process it. When it comes to renewals and SMRFs, assuming this is for food share or renewals for healthcare, they don't need to do that through online. It's not required. They have many avenues. They can always stop in their IM agency. They can always call to do those renewals. And so there are many avenues to do this. If they want to do it through Access, they also have that option as well. But yeah, it's not required.
Just to piggyback on that, applicants always have those 3 methods of applying for benefits. They can always go in, well, I don't know about COVID policies, but go in person to apply at an IM agency. They have the ability to contact an IM agency to go ahead and call them over the phone and do an application, and they always have access to be the tool to do the application. The good thing about Access is it's available to them whenever they need to go ahead and log into the program, and it secures, once they submit that application, it secures that date stamp. So sometimes, especially at the end of the month, it's very important to get that application in before the next month begins. So it's just an added tool. It is not mandated. It's definitely just an added benefit.
Right. And it looks like we've got a few kind of on similar topics. And Daniel, I think you're writing responses to them, but Will the email verification need to be completed or confirmed prior to continuing the application?
Yes, correct. In order for to have an account, that email will need to be confirmed.
Gotcha. And then similarly, if somebody adds an email address, but it's not the correct one, will the application process stop them from moving forward if the email isn't correct? So that's similar, right?
Right. So a user, if they enter the incorrect email address, they should expect to see a email verification email to verify that address. So if they don't, obviously they don't have the correct address, and so they can't continue forward. They will have to go back and re-enter that email and to resend it. One thing I didn't mention is that the user has 30 minutes to verify the email. If they don't verify the email within 30 minutes, they will have to send another link to verify.
Great. Couple more here, and we'll move forward, and we'll follow up some answers in chat just to make sure we're still kind of on track here. Will consumer be able to submit the application even though all the sections are not complete? Daniel, you already talked about that. Yes, you can submit an application with just the name and the address and the signature. The reason to do this, you want to preserve that filing date typically is why you do that. And let's see here. I think some of these I want to group for discussion later. So let's go ahead and keep moving forward, and I'll answer some more of these in chat.
Great, thanks, Adam. Okay, Marcio, we can move on to the next part. Okay, submit documents. This is the other enhancement to act for this upcoming release. This is the tool that users can go and upload their documents that if they have any verifications that they need to provide. The tool applicants use to submit documents will be redesigned and make it easier to navigate between document submission pages, understand what documents are required, how to submit those, and how to submit those documents. Applicants can get to the document submission tool through the Your To-Do list on their account homepage. Next, please. Okay, so for step one, so there's 3 steps to submit the documents. Step one is select the proof information. And so the member or the user will select who the documents are for. And so you'll select the name. Anyone that has required documentation will be found on this drop-down list. The proof type, that could be for employment, asset, you choose what that would be, and the document type. So we'll say employment, the user may select pay stubs for document type. Once they select that, they'll click on the Add Documents button on the bottom here. Go to the next page. And they'll come to step 2 to add the documents. So this is where they will upload the documents for that individual. They'll just click on the upload documents and just upload that. There is a limitation of the file must be less than 10 megabytes in order to be uploaded, and must be a JPEG, PNG, PDF, BMP, or TIFF file. Next slide, please. And once they upload that information, if this, they may see this, is that they'll see a page that will let them know that since you submitted more than one document, they were combined into a single PDF. So let's say that they submitted more than one pay stub for employment. What Access will do is that it will just combine all those pay stubs into one PDF. But if it's a different verification type, obviously, Access will not combine those verifications. It has to be the same. Once the user uploads that information, they'll come to review uploads. Access will list out verifications for the individuals and the type. This is a pretty high level, and the user will be able to remove any verification for that person if needed. If you all look on the bottom, there's a section that says there is suggested proof you can submit for for other household members. So it looks like there's also verification needed for dad. So if the user wants to add verification or documents for dad, they will have it at this time as well. So the user won't forget anyone. And once all verifications have been uploaded, they'll select done, and they'll take them to this page, which will verify that that the documents has been submitted successfully. And finally, the user will click on application dashboard, which will take them back to their application dashboard for any follow-up steps that they may need to make. And I believe that is it for submitting documents.
Thank you, Daniel. I think I'll take it from here, and we'll go ahead and we'll talk about the HMO enrollment tool. The Choose in HMO obviously is new in the Access program. And right now what we'll talk about is the fact that applicants who could be eligible for Badger Care Plus or SSI Medicaid can choose an HMO as part of their to-do list. Their HMO choices will be considered if they're approved for either program. So keep in mind, we're still following along all of the information that Daniel went ahead and shared with us, and it's for individuals who are not yet on the programs. So when choosing an HMO, applicants will have to select one of the following options. They can go ahead and select yes, and then the applicant can choose one or two of the HMOs that are available to them in their area. They can select no, and that would go ahead and say that they would like an HMO selected for them. They can also skip this process. They can go ahead and hit skip, and the applicant can always come back to the Your To-Do list and make an HMO selection or choice then. However, keep in mind, if they don't make an HMO choice, at some point, one HMO will go ahead and be chosen for them. So here are some policies that you should keep in mind as you're helping applicants make their HMO choices. First, choosing an HMO in this particular section of the application is not enrolling in an HMO, okay? So instead, it's a choice for the preferred HMO that the applicant would be interested in joining. Applicants can choose an HMO up until the point of time where the IM agency begins to process their application. After that, applicants can no longer choose an HMO. Instead, if they are approved for benefits, an HMO will be chosen for them. Now, members enrolled in an HMO for Badger Care Plus or SSI Medicaid who want to change their HMO still have those 3 months, 90 days to go ahead and make that change as of their enrollment date. Now, here are some screens that will go ahead and they will see in their to-do list. They can go ahead and see that they potentially will qualify for Badger Care Plus, that they will go ahead and have these members, excuse me, let me go back. Perhaps you can see my mouse. They can go ahead and see who is in the household that will go ahead and potentially be in the Badger Care Plus program. I keep saying potentially because they're not determined eligible yet. And then these are the steps that they'll have to pick, whether it's yes, no, skip. And if they select yes, they'll have the list of HMOs that are available to them in their area. Now, also new is the comparison tool. So applicants and members can use the Compare HMO tool to help them choose the right HMO for them. They can see which doctors belong to an HMO, and they can also see the HMO ratings. Users can compare up to 3 HMOs side by side. So they will also have a feature that's called Saved Doctors and Clinics. So what they'll do is they can go ahead and it will house information on which HMOs are covered with the doctor, which HMOs cover the doctor that they selected, and the clinics that they're interested in. They will also see the HMO ratings. Now, these ratings are maintained by DHS, and evaluate the quality of care that the Wisconsin Medicaid members receive from Badger Care Plus and SSI Medicaid HMOs across multiple HMO rating categories. And also another feature is contact information. I think this is very important for folks who are shopping around for an HMO. We will go ahead and display the HMO's telephone number and the website link so that they can go ahead and either call the member services, ask the questions that they may have, or go on their website to verify who and what type of services they offer and what doctors they have in plan. This also allows the applicant to go ahead and just be more informed on their choices. Another feature that is going to go ahead and be available to folks is to do a provider search. Applicants and members can do a provider search and find doctors and clinics that are accepting new patients. That's key. We want to know who's accepting new patients. We don't want to just necessarily know all the doctors that are in plan. We want to know who's available to set up their first appointments. They also want to find out which HMO covers them, and they want to use the provider search tool to make sure that they are selecting the right HMO for them and their family. And embedded in this tool, it's going to provide flexibility on how doctors and clinics are found. They can go ahead and use their name or their address in the search tool. There are also some filters that can go ahead and allow them to find the doctors and clinics that meet their specific healthcare needs. They can search via category, which example would be medical or dental. They can do features, which is the key one to me is the accepting new patients, and which healthcare program, which those doctors are participating in. So whether the doctor is accepting Badger Care Plus or the SSI Medicaid benefit. And they can search by specialty, gender, and language. And I think the other important thing is once they see the ones that they like, they can actually add those doctors and clinics to their account, which will be helpful when they do the plan comparisons. And once here, you'll go ahead and see the slide that indicates the name of the doctor. They can go ahead and here, they can add it to their account. They'll have other details on that particular doctor. And more importantly, where in their area is that doctor located? Is that doctor going to be close to home or is it going to be across town? So this is an added feature that can go ahead and let them know that they're selecting a doctor within reasonable distance from their home and the availability. Now, the other feature is going to be the manage your HMO for members. So these are individuals that are already on the program. So members can also manage their HMO from their Access account. So they have to be logged into their Access account to go ahead and to manage their HMO. Members can change their HMO during the first 3 months of their enrollment, which is called open enrollment. Members can enter a lock-in period after those 3 initial months. And generally speaking, they cannot change their HMO and will have to go ahead and remain in that HMO for an additional 9 months because the goal is to have them in for a 12-month period. However, bear in mind, things happen and they need to talk to somebody, and what they can always do is they can reach out to the HMO enrollment specialist if they're looking for not only assistance in choosing an HMO, but also looking to discuss some special circumstances that took place in their household or with their healthcare. So here in the card that's displayed on this side, it goes ahead and it lets them know what HMO they're enrolled in. This particular family is enrolled in the United Healthcare Community Health Plan. Their coverage date began on April 1st of 2021, and their lock-in date begins on July 1st, 2021. So after April 1st, they had an opportunity to make changes of the HMO if they needed to, and then they would be asked to remain in that HMO for the additional 9 months after the 1st of July. And in this card itself, it lets you know what Badger Care Plus members are enrolled in that particular HMO. So here is a slide in regarding your household information. So the Badger Care Plus and SSI and Medicaid members can now manage their information for each member of their household. From your household information screen, members can view the following information for each individual in their household. Number one, their preferred language, the eligibility type, are they Badger Care Plus, are they SSI Medicaid? They can see their current HMO that they're enrolled in. They can see information about the dental coverage that is offered to them and the chiropractic care that's offered to them. They can also see the doctors and clinics that they selected and saved to their account. They can also see, for those individuals who lose coverage and come back, they can see what HMO that they had previously, which I think is important as well. So the other important thing on their household card is that they can edit it as needed. Things change. They want to change the different doctors that they have, they can go ahead and do so. So they can add providers here, they can remove doctors as they change doctors. And then also here at the bottom, it lets you know what was their previous HMO that they had. Here are some screenshots of the particular member view, what members will see for them. So right here is their card that lets them know what HMO they're in, the people involved in that HMO from the household. And then also it lets you know that they can go ahead and change their HMO once they're out of that login period. And if they select that button, they'll see a screen here letting them know again, letting them know again which particular HMO they're in, who's affected, and let them know if they're selecting Anthem Blue Cross Blue Shield, it will let them know. There's a notification, which is important to know, is that they will let them know if some of the doctors that they have in their favorites are not involved in the HMO that they're interested in choosing. So it does give them a courtesy heads up that if you're interested in changing this HMO, some of your doctors are not included. So that way they can make an educated decision. But it still lets them compare the HMO to the one that they currently have to see if there are some benefits in changing. So what we'll do now is we'll go ahead and do poll question number 3, Mike, if you could go ahead and list that, please. I'll go ahead and read that. And
Thanks, Marcel.
Sure. Members can call blank if they need help choosing an HMO or with other special circumstances. So members can call member services if they need help in choosing an HMO or special circumstances, or they can call their income maintenance worker, or they can call an HMO enrollment specialist, or they can go ahead and call a family or, excuse me, a friend or a family member.
And we'll give that poll just about another 20 seconds or so.
Thank you.
And then we do have some questions that we can kind of group up and answer in a couple sections here, Marcel.
Sounds good. I look forward to them. I'm happy to see that most folks went ahead and selected 70%. They can certainly call the HMO enrollment specialist to make their selection. And just a quick takeaway, we are not taking away any of the features of calling the HMO enrollment specialist to do HMO enrollment or changing their HMO. We're not taking away the paper form that folks can go ahead and fill out and submit via mail to do their selections. This is just an added tool to be able to do this change online. So we'll close that. And Adam, hit me with your first question.
Yeah, there's a few, I think, couple categories here. One is about tribal members and HMO enrollment. And can you speak to a little bit more about, are they exempt from joining? Do they still have the option to change? If you could just expound on that a little bit, I think that'll knock out a couple of these questions.
Absolutely. Jim had mentioned this in the beginning section of the opening remarks that he had. Tribal members, as long as they self-identify that they are tribal members, the system will go ahead and recognize that HMO enrollment is optional for them. It doesn't mean that they don't have the option to select an HMO. Sometimes it's a benefit that they should go ahead and opt into. But if they identify as a tribal member, the HMO enrollment is not mandatory. It is an option for them. If you have a situation where you know that somebody is a tribal member and that their it seems like they're being forced to select an HMO, I would encourage them to reach out to their IM agency and change their status to tribal member.
Great. Couple on more about the selection process. How is the HMO selection determined if an applicant does not choose, which is a great question because we do see that a lot. And then how are these tracked?
So the first part of the question, if a individual does not proactively choose an HMO for them, the state will go ahead and do a random HMO selection for them. As far as what the proper language is for that, as far as how are they selected and how are they deemed, I'm not sure. From what I know, it was just a round robin. They would go ahead and select, you know, the next HMO on the thing, but I'm not sure how it's tracked, and I'm not sure how the selection process is done. So why don't we go ahead and take that one back at them?
But it is limited to the options that are available in that.
Oh, no, absolutely.
Yeah.
Absolutely. I should have said that, and good catch on that. It will not be choosing an HMO, all of the HMOs throughout the state. It will be solely what's available to you in your area. And if you're in an area that has 2 HMOs or more, you will go ahead and be auto-assigned to one of those 2 or 3 HMOs.
Sure. So when somebody's applying for badge care over the phone, will the applicants now be asked to select an HMO during that the phone application to mimic the online application? Or is it still kind of business as usual there?
It will be offered to them.
Oh, very cool. Let's see. And then can you talk just a little bit, I think, and knock out a couple more questions about changing HMOs. So year to year, or, you know, I think you already talked about the tribal member options, but after a year, what can somebody do if they need to change their HMO?
After a year, typically what happens is throughout the year, they find out that there's a doctor that they're interested in seeing, and they're told either by the HMO enrollment broker or they're told by the doctor's office, it seems like you're in this HMO for a little bit longer, but once you have that open enrollment period, you can go ahead and change your HMO so that you can have the HMO where that doctor is enrolled in. So they can pick up the phone, call the HMO enrollment broker a month before their HMO, their lock-in date is lifted, or after the 12-month period, they can just contact the HMO enrollment broker and find out what their options are and do a educated choice.
Gotcha. Okay, and I see a few more questions that are related to some of the previous discussion points. We will keep answering those in the Q&A function here and then save them to the end as we're able. And we do get to go till noon. And it looks like I think we're headed for that. So thanks, everybody.
Okay, sounds good. So next, what I'm going to go ahead and talk about is I'm going to go ahead and talk about the My Access mobile app. Now, since 2004, technology has obviously changed dramatically. Most of the applicants and members have access through the internet, through their mobile devices. And in November of 2018, the Department of Health Services, along with the Department of Children and Families, launched the My Access app. Keep in mind, this app is free and it is available for iOS cell phones and the Android cell phones. And features of the particular app are the following. They can check the status of their food share account. They can check the benefit status of their healthcare account. They can also check the Wisconsin Shares, which is the child care subsidy program, and W-2. They also have the ability now to submit their SMRF forms via the app, which is the 6-month reporting forms. They can view W-2 appointments that have been scheduled. They can also pay for the Badger Care Plus childless adult premium payments that are typically due when we're not in the COVID policies. So just wanted to note that the payments for the childless adults at this time have been suspended because of COVID. And bear in mind, this particular app that is available for folks, it is not compatible to all tablets. So just know that it may work on some, but it definitely is an app that was developed for the cell phones, smartphones. Additional features on the app is folks can go ahead and receive reminders that they need to take action on their case, so that they either need to go ahead and show proof of verification. They can submit that verification, and they can check real-time status of submitted documents. They can upload verification documents and check the process status of that, and they can manage and recover their account. Here are some screens for the app, for those of you who may not be familiar to it. And the blue screen, it definitely is welcome to the app. And then on the second screen that you see, it's the home page. So it lets them go ahead and see their benefits. They can check their documents. They can, again, the W-2 appointments, all of that. But also what I want to point out is there is a help text for those who may need some assistance. And there is a contact us button. And this particular screen is for the childless adults who may need to go ahead and complete the treatment needs question and their health survey as well. Now, benefit status and documentation screens are listed here. As you can see, these particular screens are for a woman named Anna, and she has her Badger Care Plus coverage that she's enrolled in. And that because it's green, I know that she's enrolled in it, but the yellow tab for the food share means that she's pending. So she needs to go ahead and submit verification, it seems like. So you go to the second screen, it lets her know that she needs to show proof of employment from Panera. She needs to show proof of earnings of interest for John Q, interest payments for John Q. It lets her know that that's due in December. And then they need proof of employment from the Marriott hotels. And who is that for? It's going to be for John Q. I should state, when it says, hello, Anna, it's the person who is the case head. And then obviously it's going to go ahead and let them know the documents that are needed, that who on Anna's case needs to provide those verifications. And then what we'll go ahead and see on the third slide here is a proof of verification for Panera. And it lets them know what is it needed for. It's going to be needed for the child care, and it's definitely overdue for the Badger Care Plus and the food share for that person. So if they hit the green button, they can go ahead and start the upload. And the first screen will let them know what steps to take, what do they need to do. It's pretty user-friendly. It gives them the green button to say, use the camera on their phone. And then the next slide, it lets them know, hold steady, because it's going to be blurry, and it's pretty user-friendly. So even for those who aren't very camera savvy with their phones, it should be able to follow and to be able to upload those documents without having to go into the IM agency or send them via fax. Once they go ahead and upload that document, they'll go ahead and see the image that was uploaded, and they can also add another image if needed. So they'll see what was already submitted. They can add an image. If they don't need to add an image, they can hit that submit button. And the good thing is that they'll have a screen that lets them know whether or not it was submitted successfully. The My Access app also allows folks to go ahead and select push notifications. Push notifications are obviously what you see here on the screen. It's a pop-up from the My Access app letting them know that they need to take action soon and to learn more. That it's encouraging them to log into their My Access account. And it also will let them know if there are some documents that are due soon. Bear in mind that the information that's going to pop up in that push notification is not going to be as detailed as one you would think. It's not going to let them know, hey, we need your proof of income or verification from Taco Bell. It's not going to be specific because, as you know, we have our cell phones with us in the public. We're sitting at a restaurant, our phone can be facing up, and we certainly don't want those individuals to have their their privacy invaded by having a pop-up with too much detail. So always encouraging them to log into the account to find out exactly what the details are. So coming on October 31st, those who have the MyAccess, they'll be able to see their Forward Health card. And members will be able to go ahead and have that visible for them. So both Badger Care Plus members will be able to have that, and the Medicaid recipients will be able to see their Forward Health card. The other card that will also be visible for folks are those who are enrolled in the senior care program. So what the card has is a 10-digit member ID number. It also has the contact information in case they need to call Forward Health Member Services. And it also gives them the instructions on how to use the card. Bear in mind, just a quick best practice is, as you're working with patients who have the Forward Health card, that physical card that is mailed to them when they're new members will still be mailed to their home. And for those individuals who you're assisting and had Badger Care Plus in the past or Medicaid in the past and had an old Forward Health card, just remember that that particular card is still valid or would be asked to be used, rather than sending them a new card, because the state would think that they would went ahead and save that card and they can use their old card. Don't expect a new one if they had benefits before. With that, the ability to use the Access app to show the card is great, but I would also encourage, as you're working with members, to have their photo ID with them when they present the card to the doctor's office, because oftentimes they present the Forward Health white card physically nowadays, and then they still ask for the photo ID just to verify their identity. Here are some numbers that I have regarding the usage of the MyAccess app. More than 260 people have downloaded the app at least once. There has been at least 3,081,000 sessions open, initiated sessions open on the app. There have been more than 549,000 documents submitted and uploaded via the app. And the biometric login has been, which is one of the new features, has been used, and almost 80% of the folks are using it. So it's either they're using 50,000, over 50,000 folks are using the Face ID, over 38,000 are using the Touch ID, and over 42,000 are using the fingerprint ID. And just an FYI, the language count, we have over 348,000 folks who use the app in the English language, and we have over 10,000 people who use the app in the Spanish language. So with that, we'll go ahead and we'll go ahead and do the poll question number 4, typo. And the poll question number 4 is, what is not a feature of the MyAccess mobile app? To be able to submit their 6-month reporting form, to be members to have the ability to complete the renewal via the MyAccess app, for members to have the ability to use the biometric login, or for members to check the status of the Wisconsin Shares Child Care Subsidy Program. So please answer which is not part of the MyAccess. Okay, it looks like I threw in a trick question. Which is not a feature of the MyAccess mobile app? And the correct answer is to be able to complete your renewal. The app itself does not have the ability to complete a renewal. A member would have to go ahead and contact their IM agency to do so.
Gotcha. So a little bit more on the app. Will the letters that they're getting be available on the app in the future? I imagine you guys are always looking to add and improve the functionality of the app. So if there's a nice to have, I imagine it's somewhere on the horizon.
Yeah, I'm not sure. I know that the letters should be available to them on the Access website itself, but I will look into whether or not accessibility of the letters would be in the app itself.
Sure. And then does the MyAccess app have all of the information from the original application they submitted on the website? Can they see that summary of their original application?
No, I believe that's housed in the Access website itself.
That's a good clarification.
This is more to manage the benefits. It's not necessarily to house all of their info.
Right. Let's see. And then is the phone app only available, can they only access the things on the phone app once their badge or their actual case has started? So basically, can they get in and use that MyAccess app? Is it useful right away, or does it have to be after their benefits have begun?
It would have to be after the case has been created by the IM agency. The reason why is that sometimes the IM agency cannot grant you your benefits until you submit verification. So once they have the application and they've opened that application, they can use the MyAccess app to complete the necessary verification portion. Gotcha. I hope that was clear.
I mean, it's one of those that kind of is what it is, kind of in terms of when they can get in and when it becomes useful. I know you guys are always looking to improve the functionality. So if there are things, I know you guys want the feedback and people will continue to raise them, and it'll become more user-friendly as that feedback is provided. So that's all I can do is encourage people to keep doing that.
Yeah, I've always said ever since the November of 18, once we created the app, is I have a wish list, and I just take back all my stakeholder feedback and add that to the wish list.
Right. Let's power through until the end. And some of these I have kind of been saving and grouped up, and we'll get to them if we can.
Sounds good. So right now, honestly, Adam, I'm just going to go ahead and wrap this up. We do have some helpful resources for folks. For the Access user guide, go ahead and utilize this particular link that's here on the how to access it. The user guide itself is for folks to go ahead and get instructions on how to use the website itself, the Access website itself. You go ahead and you use that particular guide to explain how to better perform tasks within the app. And the key takeaway here is that when in doubt, you can always contact the Forward Health Member Services phone line. They have staff to assist with technical difficulties or issues on not only the Access website, but also on the MyAccess app as well. So for troubleshooting, if you're having experience with issues with the app itself, please contact Member Services. They can help you if you're having issues creating a login, if you're having issues even logging in if you have an open account. So please feel free to contact them. And then we do have materials that are available. You can go ahead and order them free of cost so that you can have this information with you as you work with applicants and make sure that they are following through with all the hard work that you're doing when you're doing the enrollment itself to make sure that they maintain their benefits. That's the ultimate goal. And this is how you go ahead and order that information. And then if you have any questions after this session, if Adam doesn't cover them or anything like that, whether it be the portion that Daniel went ahead and covered, the portion that I covered, or if you have any questions outside of that, please contact the DHS Forward Health Partner inbox. The address is here. I'm gonna go ahead and just leave this up as Adam and I have more conversation on what the questions are that are trickling.
Yeah, and I just put that one in the chat as well.
Oh, good. Then what I'll do is I'll just close up my, I'll stop sharing.
Yeah, so people can copy and paste that. Monty, I know you might be getting some help finally, but you've been the arbiter of those questions for a very long time. So they are going to the right person, and there isn't a lot of, filter that they need to go through once people send them there.
Absolutely.
Okay, so one question I've been saving from the end, and I'm going to kind of tie in a specific one to it, is, are you guys accepting suggestions for improving either the language or the layout of the content on the Access? I know that process happened as part of this redesign. Is there a continuous process for that?
Absolutely. Just like I said, just shoot few minutes ago, I always have a wish list of things that we need to go ahead and improve. And please know that that feedback that we gather on the DHS Forward Health Partner inbox, or if I gather them as I go to community meetings, it is taken back, and we are taking those into consideration for future enhancements.
Yeah, and one of the specific pieces of feedback I wanted to share because I thought it was great, is there ever going to be an option on the Access application for people to say, and you start talking about this, can I get a new Forward Health card? I know that I'm supposed to use the one I've had in the past, but we often have to help people call and get theirs. Will that ever be part of the Access application, or can that just be feedback that you guys take back?
Yeah, I definitely will take that feedback back, Daniel. I haven't heard anything about that. Do you have any
at this time, it's a little, it's probably too late to make any enhancements, but I think that's actually great feedback. I just responded and I said that we'll add that to the wish list for future enhancements.
Thank you.
Yeah, you're welcome.
Okay, some clarification on some of the earlier stuff. So if somebody submits an application without all of the sections complete, is there verbiage to let them know that an agent will be reaching out to them for more info? What does that look like on the consumer's end if they submit an incomplete application? How do they know how to get everything in?
Yeah, this is getting to the nitty gritties. I think this is something I'll check and I'll get back to you regarding the specific answer.
Oh, sounds good.
Well, in the website or the Access application, Daniel will check on the feedback, but always whenever you submit an application, we will follow up with a verification checklist that will be mailed to the member, letting them know that we have missing information that we need to determine your case.
Right, and it's kind of a process of repeating that relevant information and communication, because yes, they're going to see that language a lot, but how effective is it? It's got to be repeated, and people need to know,
Absolutely.
when. And you have to open your mail. I can't ever emphasize that enough. If you didn't sign up for electronic notices, you need to open what comes into your mailbox, and if you did, then you need to open those emails. So.
Well, and the verification checklist and the notices of decision look quite different than they did in 2003 when I entered this field. So they're much, much more user-friendly. So don't be afraid to open up that mail.
Right. So this is kind of similar to one we've been talking about. If an applicant has started and completed an application but needs to submit documents, but basically did not do so before their deadline, is the information that was already in there lost? Like what is saved in the application? So if they submit it, then the IM agency has it, right? Then that is there still. But at what point would they need to start the process over?
Well, that gets in the nitty gritty, like Daniel said. Oh, go ahead, Daniel, go ahead.
Yeah, I can answer this one. If it's been submitted, the IM worker will receive the application. A lot of submitted documents don't have documents being submitted. And so, yep, the IM, it won't be lost, and the user will just have to provide a verification through another means, assuming that they don't have an open case. So they can send it in, they can take it to the IM agency. If they already have benefits open and they have a Check My Benefits account, they can always go there to upload their documentations on My Access or on Access as well. So it depends on their situation, but if they don't, as I mentioned, if they don't have a current open case, they'll just have to provide it else another way.
Gotcha. And one more, and then I'll wrap up with a few comments on the office hour session where you can get some more of this stuff talked about and answered. Are there different questions and authorizations for an applicant who has someone helping them fill out the application, like a CAC, like many of the people at this conference? What does it look like when somebody is helping a consumer with the application and actually answering those questions for them?
Oh, what does CAC stand for?
Certified Application Counselor.
Gotcha. At this point, I think what I'll give the partial answer. My understanding is that the only difference is the beginning. You'll be applying. You'll mark that you'll apply for. You'll be applying for someone else, and it goes. But if you do run throughout the whole application, there's no additional questions or anything else that's different. Not that I can recall, but I can double check this and get back to you.
Right, sounds good. Yeah, I think there's definitely desire to have that clarified for folks that are going to be helping people, because we know a lot of people with the public health emergency are ending up in the Badger Care Medicaid that we would have otherwise helped get to the marketplace. But with that, we are going to go ahead and wrap up. We're going to thank Marcial. Go ahead, Marcial.
Could we answer the one question that was given to Jim in the earlier session regarding the HMO enrollment choice tool? Just wanted to let folks know that we will be having a public-facing enrollment tool that will allow folks to do some shopping, take a look around, especially our partners, especially those clinics that want to go ahead and work with their clients and say, well, if you check this HMO, it looks like we're in plan with that one, or what have you. So we will have a public-facing one where you do not have to have an Access account to do that, because it's a standalone tool on its own, but you will have to go ahead and have the Access account to make those HMO selections and house that and make your changes and such. So definitely we'll have a public facing one that's more limited, but it will be more detailed if you do have an account and you're doing the enrollment yourself. So
that's really interesting about the public facing one. That's really good info. And it's HMO selection is tricky. So it's tricky for Badger Care, Medicaid, and it's tricky for the marketplace. So those resources are really helpful, but people are still going to want to call and get some additional help, I think, because it's really important that they're seeing doctors that are in network and that they're going where they hoped they could go. With that, Marcial, you're going to be joining us again for our office hour session, which will be in the morning of October 1st. That will be more of a free-for-all. That will be, I think, using WebEx link, and basically anybody can hop on camera and jump in and do questions. So if you haven't gotten your questions answered at this session or throughout the conference, please save them for that, especially the enrollment assistance questions, because I'll be running that with Julia Garvey and Marcial, and we'll go ahead and really do the nitty-gritty of how this works. But with that, I'd like to thank Daniel, and I'd like to thank Marcial for participating, and everybody else for jumping on this morning. Is, I think, hopefully very informative. But again, as you think of questions, as you're doing this work, please keep them coming.
Thank you.
Yes, thank you so much, Adam and Marcial and Daniel. Awesome, great session, so much information. And so with that, that's the end of our sessions today. We'll see you all again tomorrow. There will be a new link that you'll be sent in the morning. If you ever have trouble getting that link, you can always go to the website on the conference page. It's posted there as well as slides that are available for that day's sessions. So yes, I think that is all I wanted to share for today. And thanks again, and we'll see you tomorrow. Bye.
All right, thanks everybody. Bye.